Namaskar, Swagatam. We would like to welcome you all on our 351st journey. We have crossed yesterday 350. Now IRES, organized by IIRES and MedPharma CRO, we are dealing with. Today we are conducting 351st webinar. It is only due to your blessing, support, contribution, and coordination as a resource person and speaker and guardian all. Thank you, thank you, thank you. I don't know at what number it ends, but I would like to request our next generation that this journey should not end, as we are celebrating every day with Ayurveda or Ayush to negate the negativity of COVID-19. We are searching new topics. We are searching new expert speakers. And this is our effort to unite all dynamic persons, dignitaries, experts from all over the world. Not only across the India, but from all over the world. So, before calling Vishnu Prasad Sharma ji, I would like to communicate my sincere thanks to speakers, all the speakers, Agnihotri sir, Madan sir, Vishnu Prasad sir, Jagdishwar ji, Jayesh ji. Thank you very much. For a few words before, after Vishnu Prasad Sharma ji, I hope my daitya responsibility will be taken by Sri Madan Thangvelu sir. Welcome. Vishnu Prasad Sharma ji.
Good evening.
Vishnu Prasad Sharma ji is former principal, Government Ayurvedic College, Guwahati, and President Vishwa Ayurved Parishad, Assam. Welcome, sir.
Okay. Good evening to everybody. Respected Dr. Madan Thangavalaji, respected Professor V.K. Agnihotri, respected Pawan Kumar Sharma, speaker, gentlemen. Today we have a webinar held by Ayurveda. Yes, science and technology has given us lots of things, big hospital, big laboratory, we have big stores out there. But if we see in our society, instead of making disease-free society, in our society, disease person are more. From my point of view, yes, we have to follow the rules and regulations, whatever regulation in Ayurveda, because we have to follow the rules of the nature. Then we can keep our body healthy and we can keep our society healthy. So today we have an eminent speaker, Dr. Sriharsha, Dr. Hema, Malini, Dr. Basavaraj, Tubaki. I welcome all the eminent speaker, distinguished guests, and ladies and gentlemen to this webinar taken by Ayurveda. Once again, I welcome all of you. Thank you. Namaskar to you.
Thank you, sir. Thank you very much. Now I would like to hand over the charge of moderation to Professor Madan Thangvelu sir from Cambridge, UK, genome biologist. Welcome, sir. Welcome.
Amanji, namaskar. Very happy to be here. And it is a big feat, 351st webinar. For those on the platform here, the new people who are here with us today, all three are new people to us as far as I know. Thank you so much for sparing your time to be here with us and to strengthen this platform. This platform was initiated during the COVID pandemic times and to revisit the strength of the Indian systems, and also to erase out the negativity that was there. And this negativity is still here with us. There are many issues, global issues, where this negativity persists, and it is only a continued effort and a longer term vision about many, many issues that will give us this the way out of this negativity. We have done a lot, we are continuing to do. And one of the points I want to present here is the call at the G7 summit. Modi ji called for One Earth, One Health approach to global health governance, that we need a new perspective. And when we look at that, the need for a new perspective, and where are there any new solutions? Are there any existing solutions? We find India is fortunate we have the existing solutions in us. And I particularly want to point to Adi Shankara's Advaita Vedanta and this Vasudeva Kudumbagam idea, which is there. But somehow we are not able to connect with it for whatever reason. And I hope events like this, like what is happening today, will help us rethink how we should approach this. I'm very fortunate that we have all three wonderful speakers today. Sriharsha ji, I think we have interacted before. I know your work on Agni, that you have looked at the aspect, the understanding of Agni as presented in the rare manuscripts. You have also looked at Ayurveda perspectives and curative protocols for COVID-19. You have proposed something. So you are a leader among us here to teach us and guide us in the future. Basavaraj is very special to us because he was one of the 15 Vaidya scientists selected in a program that was running out of the Transdisciplinary University. And somehow that program hasn't been reinforced and strengthened. We are trying hard to bring it back so that we generate a group of minds who will try and connect the wealth of what is there in the Ayush manuscripts, and Ayush systems with the modern needs and perspectives. So Basavaraj is very, very special to us. And as I said, he was one of the 15 people selected from across India to be a Vaidya Scientist Fellow of the Transdisciplinary University. Hema joined us in our platform. Hema, welcome. And Hema is based in Chennai. Now, it's a very special day, and we are here to celebrate this very special day. So we look forward to hearing from you about your thoughts on the special day. What are your wishes? What is your vision? Be open, be frank, present your thoughts, and we preserve your presentations online. And this is valuable for us because we are compiling notes as we go along and making proposals. So it's important for us, but it's also important for the community at large because we can point people to the recordings and say, okay, view Basavaraj or view Sriharsha ji's presentation to get some perspectives. So it's like a dynamic library that we have now of recordings, but we can also point people to these events and tell them to consult these things. So this is a very important opportunity for us to share our views. And today is a special day, the World Health Day. And we look forward to hearing from you. The point which is emphasized again and again by many policymakers in India and elsewhere is a search for a new way to understand health, the connection of one health agenda with many factors: environmental health, human health, plant health, animal health. Everything is interconnected. And that comes through very clearly in Adi Shankara's Advaita Vedanta. But do we understand these rich concepts and the strength of these rich concepts? Can we take it to the world at large? What needs to be done? And we are so delighted we have all of you people here, and we look forward to your comments. Improvise as you go along. Give us your fresh thoughts, your wishes for the future, share them as we go along. Our format is generally presentations. If you have presentations that you want to also project on the screen, then please use the resource. And we generally take questions at the very end, and there's a very frank, open, long discussion. And our programs go on for a reasonably long time, so you have enough time to present your thoughts. We will try and finish, kind of wind the program down about 9 o'clock, which means at about 8:45, Pavanji will alert us that we are coming to the end of our time. So please draw our comments, keep them brief, and try and draw them together. So welcome all. Thank you for being with us today. And we look forward to your presentations and comments, particularly in the discussion section. Pavanji, namaskar.
Namaskar, sir.
Namaskar.
I would like to welcome Dr. Sriharsha first. Welcome, Dr. Sriharsha.
Thank you, sir.
Now stage is yours.
Sriharsha, before you start, if you give us a few words about yourself and how you got involved in Ayurveda and where you are planning your work. And it's a question for all of you, just a few words, maybe in a minute, just to say a little bit about yourself so that our audience know a little bit of your background. Thank you.
Definitely, sir. I'm myself Dr. Sriharsha. I'm basically based in Bengaluru, Karnataka, India. And I did my graduation from Sri Ayurveda Medical College in Bangalore and did my master's in Ayurveda Samhita from SDM College of Ayurveda, Hassan. Later, I took up a lot of research works related to manuscript studies because during my PG studies, I took up manuscript studies. It was one of the first, thesis presentations or the dissertation presentations during my PG times, especially in AYUSH, which was based on a manuscript. Later, I took up that work as the executive director of RPM Institute for Indigenous Science and Research, which is based in Bengaluru, and I am also the managing trustee of a trust called RPM Ayurveda Foundation. We work mainly on propagating Ayurveda to public, and also for we conduct a lot of camps for public health, and also we take care of academic programs which cater to students of Ayurveda and also other people. So and also I am working with integrated model wherein we are integrating Ayurveda along with the neurological healthcare, which is a new arena, especially in the metro cities right now. So in neurological health, I am catering or augmenting with Ayurveda procedures, especially in the cases like post-stroke complications, Parkinson's, or any other neurological disorders. And I'm also relatively doing my work in academics and also some of the Samhita studies and also training some of the students who are interested in bridging the gap, especially which is required for the present day situation. So this is in brief about me. Thank you, sir. Thank you for providing an opportunity to be here in this platform. This opportunity was, guided to me by my doctor friend, Dr. Madhusudan, who is based in Mysore. He works in JSS Ayurveda Medical College. So through him, I could join this platform, and I thank Pavan sir for giving me this opportunity to speak a few words and share my thoughts on this platform.
Harsha, if you can also put it on presentation mode, keep in mind your presentation will be very valuable, all your information. So if we come up to presentation mode, then it'll look better better on the screen. Thank you.
Fine.
We have noticed recently some people have difficulty in getting it to the presentation mode.
Yes.
I hope we can solve that here.
I think it is on the presentation mode right now.
Okay, there is a problem
Are you
because
able to see screen, sir?
we can see we can see your outline on the left-hand side, and we can see your slides. Now, this is are you seeing it as presentation mode on your screen?
No, sir. There is some thing. I think I'll have to be given the access to.
Okay, I think Pavanji will give you access to present.
No, his slides are visible, sir.
Is it in, Pavanji, is it in presentation mode or is it in the small?
Slide mode.
Slide. It is in slide mode.
You can start presentation. रखो ना खोला इसको, रखो ना.
Is it fine, sir? Can I proceed?
Yes,
So-
yes.
Fine. So today we'll see about some of the perspectives about holistic health through Ayurveda. So before we get into this topic, I would like to wish all of you World Health Day and happy World Health Day. And what else could be better than speaking about Ayurveda on this particular day? It will be a pleasure for me to share my thoughts because as being of the fraternity of the healthcare system which has been since centuries and being the oldest of all the other health systems, we have a lot of philosophical approach and also practical approach in dealing with health. So, with this background, let us try to understand what is holistic health and how Ayurveda fits into this particular dimension of health. So, the first firstly I would like to just give you an introduction that what all I'll be covering in this particular session. So by the end of this session we will be knowing what is holistic health, what is the Ayurvedic perspective towards holistic health, and what are the methods to make our life all inclusive. When we say this word holistic, it means that everything is included, so life all inclusive. So what does it mean and how do we make that practically? So that is very important for us. So by the end of this presentation probably I would like to I would be able to give a meaning for this.
Sriharsha, your slides are not moving.
Just a minute, sir.
Thank you.
Yeah, just a minute, sir.
Now moving, doctor.
Now is it moving?
Objectives.
Yeah, fine. So I'll be covering what is the definition of holistic health, Ayurvedic perspective towards holistic health, and methods to make our life all inclusive. So are you able to see this slide, sir? Slide number 3, which speaks about Purnamadah Purnamidam.
We are on slide number 2 still.
Yeah, fine. So we know that in our Indian classical texts or even in the Indian perspective, Purnatva has been given a lot of importance. Wherein Purnatva means something which is whole. And this particular shloka, that is Purnamadah Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnamevavashishyate. So this is the mantra which is usually chanted before any of the ritual or anything which is to be done completely. So the state of completeness, when we speak about this concept of Purnatva, is very important to us. So when we say that completeness, what is this completeness? It may be in different aspects. For example, it may be physical in terms of, if we consider health as such in one perspective. For example, the modern perspective always says that if you are completely fit, that means you are, all ready to face the challenges of the world. But in some other perspectives, if you can see that mentally if you are good, or if mentally if you are all complete, or that means you have acquired all skills, that means you are good, or you can face the challenges of the world. So, another aspect if you consider is the emotional aspect. Emotionally also we need to be complete, or we need to be more and more we need to have more and more strength. That is one aspect. Another aspect is socially also, that is we need to have a social balance. We may be mentally healthy, physically healthy, and also emotionally balanced, but we may not be able to interact well with the environment. So all these things together makes the health, or we consider all these things when we consider holistic health as such. So when you consider holistic as health as such, you can see that this is a very ancient approach to life as such. That is, that whenever we consider a child has many things to learn. That is, there will be physical growth, there will be mental growth, there will be emotional growth or emotional attachments also, and there will be a lot of spiritual things which we learn from a child even. And further on, when we go on, uh, our life is, always influenced by the world. That is, there is a relationship between the man and the environment. So what happens is, sometimes this growth gets affected or influenced by the environment. So it is very important for us to control the environment sometimes, or if we cannot control the environment, at least we have to adapt to the environment in a particular way. Only then we will be able to attain completeness or fulfill our dharma, artha, kama, and moksha, what we call as Chaturvida Purusharthas. Therefore, the Ayurvedic perspective or the Indian perspective, if you consider this ancient approach to life, doesn't only focus on illnesses or specific parts of the body or specific things, specific only certain aspects of the life. It considers the whole person, or how he or she interacts with his or her environment. This is very, very important. So, when we consider the holistic health as such, the concept of loka and purusha, that is, loka means one which is around us, and purusha is us or the human being as such. How he interacts with the environment, that becomes very, very important. Therefore, as an individual, the emphasis is always laid on the connection between the mind, body, and the soul or the spirit. So this probably is one of the definitions we can, interpret with the holistic health. Only then we will be able to understand that, the actual definition of health. So in Ayurveda, this is very, very beautifully designed when it says that perfect harmony of mind, body, and consciousness is the state of health. There is samadosha, samagnishna, samadhatu malakriyaha, prasanna atma indriya manaha swastha ityabhidiyate. There is prasannata of atma, indriya, and mana along with the physical health. All these things are very, very important. And then when we speak about the health as such, holistic health as such, what is the outcome of this? The outcome of physical health and mental health is that we will be able to adapt, like as I said, that we should be able to adapt to the environment well. Only then we can, fight for our existence, one thing, and also thrive in this environment and also achieve something. Therefore, when we consider these things, it relates to the building up of immunity. It may be physical health or mental health, or physical immunity or mental immunity, wherein we are able to adapt to the environment well and also build up a resistance of, adapting ourselves to the environment, so that it will be helpful for to face any kind of challenges we come across during our life. So, when we consider holistic Ayurveda, it is mainly two aspects which we usually deal with. That is the prevention of disease. That is, in a healthy individual, how do we prevent a disease? That is one important aspect. And second thing is the curing or pacification of the diseases. So, for both of these things, the immunity or, the resistance is very important. So, what do we expect, or what do we mean by holistic health? Like when we say that we should, you know, increase our immunity, what should we do? We should always do things right. It's said that, say, when we consider many definitions of Ayurveda, like hita hitam sukam dukkam ayustasya hita hitam manam cha tatra yacha uktam Ayurveda suchyate. There also they emphasize that we should always have sukhayu and hitayu. And also it is said that, like when we consider any kind of yoga, that is any combination, that is any interaction between the man and environment, we always consider three important things, that is ayoga, atiyoga, mithya yoga, and the best one among that is the samyak yoga. That is, if there is samyak yoga, then samyak yoga is considered to be roga arogyascha karanam. That is, for the roga or arogata, the samyak yoga or yoga is very important. That is the right combination. Therefore, Samyak Yoga is the normalcy, and anything apart from that, that is wrong, doing things in the wrong way, or doing things in excessive way, or doing things in the lesser quantity or quality. All these things are not recommended. So doing things right is very, very important for us. So that is the, probably the substrata which is important for us, because if we know what is right, then only we will do things rightly. So this is the, core of this particular topic what we are speaking today. So we will be focusing on what are the things which are right for us, which will lead to samyak yoga, and it will lead to arogya. So we need to question ourselves whether we are doing all these things right. So if we consider the at the physical level, we have to uh, ask ourselves or question ourselves that are we doing these things really right? For example, first thing is, are we sleeping at the right time? Because sleep is one of the most important things which influences our health. When we say sleeping, it also means that are we waking up at the right time? So sleeping and waking are together. So it's mainly about the nidra. That is, we know that ahara, nidra, and brahmacharya, that is the right sleep, right eating habits, and right activity, are the three pillars of life. So when we consider this as a tripod, sleep is very, very, very important. That is, the rest which we give to the mind and body is very important. So if we do that at the right time, that is, however our body asks, in the similar way, if we can adapt to our body clock, then that will be very, very important, and also influencing our health. The second thing is, are we evacuating the metabolic waste at the right time? That is, we say that the Vega, that is Vegan Nadhare Dhiman. That is, if you are Dhiman, Dhiman means if you are a Buddhivanta, that is, if you have a proper intellect, then you should always, obey to what your body is asking for. Therefore, evacuating the metabolic waste is very, very important. We already know that there are a lot of metabolic waste in different forms, and that has to be eliminated out of the body. If they are not eliminated, then they'll cause disease. Therefore, the right time means the dhare to sada vegan. If we are considering the vegas which are to be controlled as such, they are a separate list. That is mainly the raga, dvesha, or it may be anything which is related to the mind, which has to be controlled. You have a separate entity, or the a science which is explaining to you how to control the mind or how to control thoughts, etc. But we are speaking about the physical factors which are really malas, or which can do dushana of the sharira. Therefore, those have to be controlled. Those should not be controlled, and it should not be kept in our body for a longer period of time, because they will definitely cause diseases, and that may lead to a lot of complications whenever it's accumulated beyond the limit. So therefore, eliminating the body waste is very, very important for us. Then is eating at the right time. Why I have kept evacuation before eating is because there is a rule in Ayurveda that before you eat something, the earlier food or ahara should be properly digested and assimilated. After that, only you are supposed to take any kind of food. So therefore, eating at the right time means that before you eat, you should think that whether the earlier
Your slides are not moving, doctor. Puna Punamidam Punat Punamudachate.
Oh,
This
it's
is the
there only. Okay.
We are on slide number 3.
Now, sir.
Sriharsha, if you could quickly go through the previous slides, just so that we know.
Okay.
There is a problem. I don't know why we have a problem advancing the slides.
That's what.
Please.
now it is 8 number, sir. Avdesh ji namaskar. Avdesh ji namaskar.
Sir, I'm on slide number 8 now.
Yes. If you could you show us the previous slides that from slide number 3, just quickly, so that it is on recorded, and we will alert you again if the slides are not moving. So apologies for this.
Right now, sir?
We are on slide number 8, but could we also see the previous slides?
Now I am on slide number 4, sir.
No, it is still on slide number 8 now. Apologies for this. I don't know. There is a problem. Yes, thank you. We are on slide number 4. Thank
Yeah.
you.
So
Could
I
we
was
see?
talking about, I'll just quickly go through these four
Thank you.
slides, it will be easy. So I was speaking about the holistic health, that is how our ancient approach to life included the concept of holistic health. That is, we were mainly focusing earlier on not on illnesses or specific problems as such, but the body or the whole person as a whole. So, and also the key important factor there is the meaning of holistic means that how we or how a particular individual interacts with the environment. So it is a relationship between, or a give and take relationship between the man and environment. That is very, very important, and that was understood and also practiced and also applied in our science very well. So the emphasis was also given mainly on the connection of mind, body, and soul, or the spirit. The definition of health in Ayurveda also speaks the same thing, that is a perfect harmony between the mind, body, and consciousness. That is, which is connected with the definition of health or swasthya, which is very relevant to today's world also. So when we were speaking of that, we were speaking about physical health and mental health, the outcome of which is mainly building up the immunity. When you speak of holistic health, it is important for us to have a keyword with us, so that what should be focused on. So I was speaking on the role of immunity in maintaining our health. So therefore, if we have this particular keyword, it will be easy for us to understand the whole whole scenario of holistic health, and it will be easy also for us to apply the aspects of holistic health in our daily life. So when we consider the holistic Ayurveda as such, like when we say that Ayurveda is holistic, how is it holistic? It is holistic because it has already included two aspects of of health, that is prevention of disease and also pacification of diseases. So it gives equal importance to both of these. Therefore, it is considered to be holistic. That's how Ayurveda perfectly suits to the definition of holistic health. Later, we were discussing about how um, this has to be implemented. That is, when we say holistic health, or when we say that the immunity has to be built, what has to be done? So the answer is that we have to do things in the right way, what it is called in Ayurveda as Samyak Yoga. So whenever we do anything in the right way, we will get right in outcomes. So anything which is done in a wrong way, or in an excessive way, or in a a less way, or which is not sufficient, then it may not give us proper results. Therefore, doing things right is very important for us. So then in the next slide, we are now discussing about how we need to ask ourselves or question ourselves and interrogate ourselves that are we doing all things at right time. So when we consider the physical health, mental health, and the social health, firstly we are speaking about the physical health, wherein we'll be considering the Ahara, Nidra, and Brahmacharya. That is the three aspects. That is, Ahara means the right way of eating, right way of sleeping, and right way of doing our activity. So these all these three things are very, very important for us, and for all these things we interact with the environment. So all these three things are related to us, and how we interact with the environment, that's how we get the results, or the outcomes are listed in that way itself. So I was just looking about these things, that is questioning ourselves about the right time of sleeping, right time of waking up, evacuating our metabolic waste at the right time. Because many a times in Ahara, Nidra, and Brahmacharya, if we consider, the Vegas are Vega, that is the elimination of the metabolic waste, are not mentioned in the Ahara, Nidra, or Brahmacharya. But in the aspect of Ahara itself, I think it is very important for us to consider that also. Because before you eat right, you have to make sure that the previously digested food is eliminated out, or it is completely digested and then eliminated out, so that we are ready for the next food. Then is the activity, that is, are we doing the activity in the right way, which is leading to perfect health. So exercising at the right way, in the right way, is very very important. We know that there are a lot of people who do a lot of exercises but may not end up in good health. So it's very important for us to know that what is right for our body. We have to consult a proper doctor. Especially Ayurveda doctors are much aware that how much vyayama, or in what season, or what time of the day, or what condition, what kind of exercise has to be done. So it is always better to consult our doctors, or Ayurveda gives us a very important and a very detailed description about exercising in the right way, and that's how we can claim our health based on the right way of doing exercises. The next thing which we are seeing in today's scenario is sticking on to gadgets and not to have interactions with the family. So this is very very important because we know that though we are, a social man is considered to be a social person or a social animal as such. So we interact through different modes with other people, but the mode of interaction through a technology or a system is not always welcoming, and also it has a lot of side effects and also disadvantages. Though it has many advantages, we are seeing that it is leading to a lot of health problems. Therefore it is very important for us to consider this and probably stick on to only some of the aspects which are very very important and which can give us more ease while we interact with using these particular digital modes while we interact with people. Otherwise the conventional methods are always better, which gives us more happiness and more emotional well-being. The next aspect which I want to communicate to you is communicating the right way, because many a times we'll not be able to communicate to people in the right way or the way which we want to communicate to. Sometimes there will be a lot of misconceptions, there may be wrong understandings, and because of that we may suffer with a lot of wrong implications because of that, and we may end up in things like depression or anxiety or panic attacks, all these things. That is mainly mental disorders what we see. So it is very important for us to communicate well or in the right way, and at the same time we also have to have a check on how our thoughts and actions are moving in our body. That is how we are thinking, the way we are thinking, and also how we are acting. The way it's not always true that whatever we think we'll act in the same way. Our thoughts may be different, the way of action may be quite different, but if we are thinking the right way, there is always a possibility that we will be acting in the right way. Therefore always thinking right, or thinking good, or thinking for the welfare of the society and also for ourselves, that which is mentioned as hitayu in Ayurveda, that is very very important for us to keep us healthy and also keep the environment healthy and all other people around us healthy. So how do we identify that, if there is any kind of disturbance in the body? How do we understand that what is right and what we should do to rectify all these things? So many a times our body sends a lot of signals to us, but we may not be able to identify it. Therefore, we have to first understand, or we have to create an awareness in the people that what is normal. For example, in the modern world, we know that many people are very, very aware that our BP should be, our blood pressure should be so much, or they are very, very well aware about the the measurements of the parameters which the body has. Maybe blood pressure, it may be temperature, it may be any other parameter, like it may be the blood sugar, or the nowadays people are learned people know more about their lipid profiles, they know about their BMI, many things like that. But naturally we know that our body sends a lot of signals each and every day if the body is not really adjusting to the environment. Therefore we need to just be more you know more inwards towards ourselves, so that we have to concentrate towards our inner self and try to sense these body signals, so that we will get to know that what is right, not right for our body, and how can we make a simple change in our daily lifestyle, so that makes a lot of difference in our day-to-day health. So we have an answer for that. That is why our acharyas have, that is in Ayurveda, we have the descriptions of the dinacharya and rutacharya kept in the very first section of our samhitas. That is, we have the dinacharya adhyaya, which is there in almost the initial sections of all the samhitas, so which gives us the correct way of following things, or identifying our body signals, and also keeping us more healthy and more wise. And thinking wise always will give us a lot of inputs to keep ourselves more and more healthy. So what is wise for us? So the wise decisions with relation to body is that you have to be wise enough to make sure that you are waking up early. You should have good oral hygiene. That is, you should have do the danta dhavana, etc., which has been explained in Ayurveda. You have to evacuate your bowels well, or the bladder well, in a proper way. Because the mode of action also is very, very important. The right way of doing things or eliminating the waste is also very important. Then the fourth one is the exercise, that is properly having the ardha shakti vyayama. That is, we call it as doing the vyayama how much ever your body can tolerate. So we have seen many celebrities also succumbing to this particular fad of over exercising. So if you over exercise, there is all possibilities that you lose your immunity, and because of that, or if anything ati, that is what we were speaking, that anything ati yoga also may lead to ill health. Only samyak yoga, or the right way of doing things and in the right quantity and in the right quality, will give us health. Therefore, exercising in a normal way, or whenever your body signals that you have a little bit of sweating over your forehead and you become a little fatigued, then you will have to stop it, and also make sure that whatever is your strength of the body, you have to respond to that particular strength, and make sure that that helps you in your daily life, or keeps you more and more healthy. The fifth aspect is the physical hygiene. Physical hygiene is very important. You know that the Indian tradition gives a lot of importance for physical hygiene. Probably in compared to any other parts of the world, Indians have this already the tradition of taking bath every day. Making yourself more, more and more beautiful with the help of different paraphernalia, and also make sure that you present well, or present well in front of others, so that other people get a sense of positivity from you, and also you are also always charged with positivity. The next important thing is the eating habits. That is, you are not supposed to eat anywhere, anyhow, or anything. So that is very, very important. This is a tradition which is imbibed in the culture of in the Indian culture, and also in Ayurveda. Also, we have Ashtavida Ahara Vishesha Ayatana. There is the rules and regulations as how you have to take food, what should be there in your food, and what should be the environment when you are while you're taking food, what kind of food should you take, and how should it be cooked. All these things have been discussed in the samhitas of Ayurveda, and also it is very simple. In a simple way, you can see that some texts like Bhojana Kutuhala or Kshema Kutuhala also includes these fundaments into that, and then they have explained a lot of recipes which are tasty. At the same time, it follows the fundamentals of Ayurveda also. So, the eating habits are very important, because in today's lifestyle, we see that there are different theories and different concepts which have come in, creeped in, because we have become a global person or a global man. So when we adopt things, it is very important for us to understand that wherever we are from, that is, our own culture should always be kept up. That is, our culture is based on our environment, that is this desha, what we call, or the environment wherein we are brought up, and also we are born and brought up. Both are important, right? Janmataha and vyavasayataha, we say. That is, janmataha, that is wherever we have been born, that particular place gives us a lot of strength or immunity. The bala is dependent upon that. Therefore, eating habits and also eating the foods or the the nature of food which is grown in the area where you are born and brought up is very important for us. That will give us more and more strength. It will give more bala. For example, Punjabi takes a lot of milk, but probably people in south do not take so much of milk or milk products. People in South India don't take much of wheat, but people in North India take a lot of wheat. But people in North India do not take ragi at all. But some people in South India, particular region especially, they take only ragi all through their life. But they are equally healthy and they have a long life, and they are having all physical, mental, and emotional, and also spiritual strength even. So that makes us unique from each and every person. So therefore there is some uniqueness in everybody, that is depending upon the desha, or depending upon the place of the birth, and also where you have been brought up. So eating habits are also very very important to be understood based on your environment. That is a man's environment. The most important thing, or the last important thing what you can see, like when you retire, at the end of the day, sleeping pattern is very important. That is where you sleep, how you sleep, and also if you are sleeping, what time, like what is the duration of sleep. Usually we come across many patients asking us that the sleep patterns are cannot be maintained well because we work in different shifts. So Ayurveda already has given a lot of importance to this, and also has understood probably will be people will have this problem. So it gives us a formula, very beautiful formula, when it says that if you have compromised a particular duration of sleep, you can compensate in the daytime only half of what you have compromised in the night time. For example, if a person is sleeping at around 10 o'clock since his childhood, and wakes up at around 5 o'clock in the morning, so his number of hours of sleep is around 7 hours. So if he, in case because of work, or because of some other reasons, he is not able to sleep at 10 o'clock, but he probably delays and sleeps at 12, so he has 2 hours of deficit of night sleep. So he cannot wake up in the morning at 7 o'clock. He has to just compensate only half of what he has compromised. That is, if he has compromised 2 hours of sleep, he can compensate it with only half of it, that is 1 hour of sleep. That is, if he is waking up generally at 5 o'clock, he can wake up at 6 o'clock in the morning. So this is how he can compensate, so that he will not feel more tired, he will not feel lethargic, and that much of divaswapna will be sufficient for him to go through. So the whole day we can see that I have tried it with many people, and with myself also, even with my patients, that it works very well. And this formula probably on the long run also works. And people who have different shifts at different times of the week, for them this is a perfect solution. Even people who have 15 days of night shift and 15 days of day shift in a month, for them also this works wonders. So, with respect to the body and senses, if we consider, there is the Sharira and Indriya. This is very important for us to understand that increased screen time has a lot of ill effects nowadays, and we also have to make sure that this should be reduced. We have to use some, some shields for the screen, or we need to make sure that the distance from the screen to our eyes is reduced as far as possible, and also make sure that there is no much bright light we are seeing. Our artificial light exposure to artificial light is decreased, and also exposure to natural light is increased. So we have to make sure that early morning we expose ourselves to natural light, and not be only in artificial light always. So only then our senses will react properly. We see that many of the patients, in our daily practice, especially in neurological disorders, we see that many children are affected with these kind of sensory issues, the sensory integration, what we call. So the body will not be properly integrated with the senses. So this gives a lot of problems probably in the early age or in the adolescent age, and also further. So the lot of issues like ADHD or autism spectrum disorders are even related to this sensory integration. That is sensory non-integration you can call, which is a very serious problem, and we can see that many of our children are getting affected because of this. So the reason for this maybe are sticking on to gadgets, or the mother is not taking care of herself during her pregnancy much. So therefore, this sensitivity to sensory organs, and also making ourselves more, reactive to things. That's very important too. Because there is a very subtle difference. All these senses, the indriyas, are considered to be the prana. Indram Shabdam Prana Uchite, it is called. Like the Indriya Shabda, if, as such, if you consider, Indra means prana, and you know that all the sense organs have prana, or they exhibit their form of expression of our body, or what we think and what we do. All these senses, maybe it may be sensory organs, that is the Jnanendriya or Karmendriya. So all these indriyas are to be kept, in a well organized manner. Otherwise, if the sensory and the motor control is lost, then the person is not, fit to be there in the environment, or he cannot, have a normal interaction with the environment. This is a very important thing which we have to consider. So the how do we control this, or how do we make sure that the balance between the mind and the body is maintained well? So when we consider that the emotional culture, like especially in the Indian culture, we have a lot of importance for creative arts. That is, arts are almost a part of our life. Even Ayurveda consider this as one of the major important things, or important aspects in enhancing the health. Therefore, positive thinking can be achieved with the help of creative arts, doing meditation, or involving in prayers, involving in group activity, and also many of the Indian traditional arts like Indian music, or it may be painting, or it may be dance, or it may be any other form of art which will build up our emotional culture, and also make sure that our mind works well, or works in a positive way, and gives us a lot of fun and also happiness. So if our mind is happy, our health also will enhance definitely. So we can see that usually artists who enjoy their life with all these emotional culture, they live long, and also they will have a lot of positivity, and they influence a lot of people. And you can see that artists are greatest influencers in the world. So the influence comes, like for example, you consider celebrities of who are in the cinema world, or it may be musicians, or it may be painters, or it may be singers. They form the the core of influences in this world, right? So and we accept this, and that's how the world also runs. So therefore we can see that if we become more and more emotionally cultural, or if we are involved in creative arts, then that gives us a lot of health, and we can start influencing people also very well. So it is important for us to understand these things, that holistic development has to have a practical approach, which will be involving a comprehensive learning system. We'll always have to learn, always imbibing new things and learning new things are very important. Therefore, comprehensive learning system which includes physical, social, emotional, mind, and spiritual growth. All these things are very important for us to understand this. So if we have a practical approach towards doing these things, then probably we can achieve holistic health. So it's all with what we think and how we do it, or how we will be able to implement it. So therefore, creating a balance between the mind, body, and soul is important for us. So if we consider the body as our substrata, we have the next level, that is the mind, which has a dual nature. It can go both positive and negative. And then is the the soul or the spirit, which gives us the understanding of knowledge or wisdom. So therefore, this connection between the body, mind, and wisdom is very important for us to have a holistic health. So with this, probably giving these tenets of information, we could achieve at a reasonable understanding that holistic health doesn't only mean saying that it is holistic or it includes everything. What all will it include? We need to list down and also know what has to be practically implemented in our lives so that we achieve holistic health. So looking forward to your comments and also other presentations from other doctors from in this platform. I would like to thank once again the organizers for giving me an opportunity to share my views about holistic health through Ayurveda. So I thank all of you. If there are any questions, probably we can take up at the end of the session as guided by the mentor.
Thank you.
Thank you.
Sir. Thank you so much.
Madan sir.
Sriharsha, thank you so much. Unfortunate that we had some issues with the slides. You have prepared so many wonderful slides, and there was a little bit of confusion in synchrony, but you have given us some very, very strong indicators. All of the only comment I want to make now, which I will bring up again in our discussion, is that when we look at contemporary literature, we see all the ancient knowledge being validated. And I have put in the chat box 2 references here. First reference comes from a group in Switzerland. And they are now, in the abstract, it talks about yoga as a way to do this. So this is coming from Switzerland, from the Department of Gastroenterology and the University Hospital of Psychiatry at the University of Bern. And you can see they are accepting the benefits of yoga in modulating the vagal tone activity and the vagus and the vagal tone. Now, we have much more wonderful insights from the old text. Particularly, you are able to look into the old text and come up with very, very subtle points. I hope we can engage with people like this researcher in Switzerland. So this is just a pointer. The second point I just want to add here is about screen time and adolescence. You've elaborated on that very nicely. And this talks about respiratory sinus arrhythmia in children who are watching things on the screen, and also the content they are watching. So it is not only screen time, but also the content and how that has an additional effect on the respiratory sinus arrhythmia. So we will come back to both these points. Thank you. Thank you very much. Before our next speaker comes, I just want to see why we have this difficulty in not being able to display the presentation mode. So I think
it is not from our side, sir, because we have discussed with Zoom authorities.
Okay.
So this is not from our side, because some presenter can able to present, sure. Otherwise this is in their computer's problem.
Okay, so we will check with our next speaker. I think Basavaraj.
Right.
Okay.
So I would like, if you kindly permit me, I would like to invite Dr. Hema Malini ji. Dr. Hema Malini ji, welcome.
Hema, very happy.
Am I audible to you? Dr. Hema ji.
Hema's connection. Hema, namaste.
Yes, she has joined. Okay. Dr. Hema is founder of Sriharsha Ayurveda Holistic Healthcare and ex-government medical officer. Welcome, madam, from Chennai. We would like to welcome on this platform. And now the stage is yours. Welcome.
Thank you. Thank you, sir.
Namaste, Hema.
So, my heart pranam to all and to all the eminent people present here. Yes. First of all, happy World Health Day to everyone. And my already covered almost all the points regarding the holistic healthcare. So the left out points I would like to add here. And I always prefer to start my speech or any session with the prayer. So kindly join with my prayer. Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kurme Deva Sarvakaryeshu Sarvada. Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Yes. Actually, the way the Anjali Mudra, this is called the Anjali Mudra, the way I have used here in the start of my speech has a connection with the content what I'm going to present today. Actually, this is my own clinical experiences, what I'm going to share with you all. If you have any queries, kindly make a note and we can discuss at the end of the session as the organizers had mentioned. And I'll start my topic with the 5 koshas, the 5 koshas of Ayurveda. That is our Annamaya kosha, Pranamaya kosha, Manomaya kosha, Vijnanamaya kosha, and the Anandamaya koshas. So, as we very well know, whenever a patient, usually I do not mention anyone as a patient, approaches us, we usually used to get the history of that health seeker. In that, first we'll try to manage the symptoms, the presenting symptoms with the lifestyle modifications and the diet modifications. In my opinion, almost 20 to 30% of the symptoms will get reduced if we start managing to approach by going through all these lifestyle modifications and diet modifications of that particular individual. So this covers the Annamaya kosha. Then comes the Pranamaya kosha. So for that we use the yogic techniques like pranayama. Here also some asanas also takes its part, mainly the pranayama part. And then comes the Manomaya kosha, Vijnana and Ananda. So these 3 entities are actually subjective things. So these can be handled with a particular way of treatment. Is I take it in the way with the chakras. The treatment by stimulating the chakras. So now comes the topic. What are the chakras? What is chakra? Chakra is nothing but the energy reserve points. These are the subjective points. It can just be felt and not be seen. But this can be correlated with our medical science as the plexus. So there are 7 chakras actually. The first to mention is the Mooladharam, then comes the Swadhishtanam, then Manipurakam, then Anahatam, Vishuddhi, Agnya, and Sahasraram. Today we are going to go in detail of all the 7 chakras and its relation with the holistic health. So the first 2 koshas have been covered with the lifestyle modifications and diet, second one with the pranayama, yogic techniques. Now comes these parts. So now, first, we will try to feel the energy. How can we feel the energy around us? Energy is within and around us. How can we feel it? So first we can start rubbing our hands like this. So after rubbing, when we start trying to feel it, At one point, the hand tries to repel itself in our own place because the energy is omniscient. We can start trying it. At one place, it repels. Yes, I can able to receive the energy right now. These are the universal energies in and around us. Yes, it is actually 360 degrees. It is all around us. So this is what the energy is, universal energy. This is what we call the aura. So this energy has to be circulated without any obstacles in the nadis. The nadis are the Ida Nadi and the Pingala Nadi, which runs in the left side runs the Ida Nadi and Pingala Nadi is the right side. So in between runs the Sushumna Nadi. So when we see the symbol of the doctor symbol, we see two snakes intertwined like this. So the left would be the Ida Nadi, right would be the Pingala Nadi, and in between is the Sushumna Nadi. When these two snakes intersects, there will be certain points, the point of intersections. These represents the chakras or the plexus, according to the modern medical science. So when due to our lifestyle activities or the diet, there may be some changes or certain obstacles or hindrances in these chakras, in the energy flow. So by doing certain mudras for the specific chakras, we will be able to relieve those obstructions. So wheels can be done and what chantings can be done. So here the chanting also takes its place. Chanting actually relieves the obstacles in the each chakras. So now we can go in detail for each chakras. Before that, I would like to mention one more very important point is the posture maintenance. The posture maintenance of any individual helps in aligning the 7 chakras in a very straight line so that the energy block will not be seen. So the posture maintenance gives us the right way of breathing. The right way of breathing will give us the right thoughts. The right thoughts will lead to right way of actions. So everything starts with the upright posture. So before going into the mudra part, I would like to mention certain things about the mudras, hand gestures. So what are mudras? Mudras are nothing but it works upon the 5 basic principles. The thumb represents a fire, air, space, earth, and water. The 5 basic elements. When we try to bring the fingertips like this for each gesture, the energy transfer starts occurring in this area. So whichever element is more, we give it to the universe. Whichever is less, we will get it back from the universe. So this acts as an energy cycle, energy transfer. So the electromagnetic energy circuit occurs in this area. So when we start sitting in a upright position, automatically the energy starts circulating throughout the body. We can instantly start feeling the energy from the place we are, wherever we are throughout this universe. So because as the energy is very much omnipresent, wherever we are, we can start feeling the energy. For that, I will tell you one simple mudra so that with the end of the session, we can all feel the energy. For that, we bring the fire element, earth, and the water together. So by being like this for at least 5 to 10 minutes itself, we will start feeling the energy levels gushing up. With this, even the immune power increases, the immunity increases, the vision increases with this. So this is such a wonderful mudra. I usually recommend to all the health seekers during the COVID times. So this is such a boon for us, and this is actually meant to be done in the morning and before 6 p.m. because after that our sleep pattern, the circadian rhythm may get altered. So before 6 p.m. this can be done for at least 20 to 30 minutes per day. By doing this, definitely our energy levels would increase, and even our rishis were doing this, and we can gain energy even without intake of food. So they were able to sustain in their tapas with all these kinds of mudras and pranayam. So actually speaking, now we will be coming into the actual topic of the chakras. And at last, I'll be giving 2 tips for the upcoming generations. So now I'll go with the chakras. So Mooladharam. Mooladharam is nothing but Moola Adharam, our anal region. There runs the Mooladhara chakram. That chakram actually rotates in the anti-clockwise direction for the male and clockwise direction for the female. So when it starts circulating in a different direction, the symptoms starts occurring for us. For example, the physical symptoms like constipation, piles, that is hemorrhoids, and fissures, fistula, all these occurs when the Mooladhara chakram is not properly functioning. So when this not only correlates with the physical entity, but also with the emotional aspects. The emotional aspects is the person who has not a good energy flowing in the Mooladharam will not be grounded. He will be, that individual will be somewhat feeling insecure. They will be having the inferiority complex, and they will be having some voracious thinking or voracious nature of acquiring material things. So these sort of imbalances will be seen when the Mooladhara chakram is not properly functioning. So what can be done for this? We can start doing certain mudras with certain chantings. So the mudra for that particular chakra would be the Apana mudra with Lum chant, L-U-M, Lum chant. So once I'll start to recite it, first. Yes, like this, when we start reciting the bija mantra for each chakra, automatically the chakra tends to get stimulated. The energy is everywhere, but we are like radio antennas. We will start receiving the energy only with certain bija mantras for each chakras. So for each chakra. For this, we would represent red color. Mooladharam, red color, Apana mudra, and the chanting would be Lam. And the gland we associate, endocrine gland we associate for this Muladhara chakram would be adrenal gland, and the sacral plexus can be correlated with this. So this is all about the Mooladharam. Then comes the Swadhisthana. Swadhisthana is a little bit above the Mooladharam. This represents the reproductive or is the key of this Mooladharam. Swadhisthana. So physically, we may see certain reproductive organ related diseases, maybe the PCOD and menstrual irregularities or any infertility, all when the Swadhisthana chakram is not in an alignment. And even the skin related changes will also be seen when the Swadhisthana chakra is obstructed. Mainly the low back pain. Low back pain, if there is low back pain in any of the individual, definitely this chakra, once stimulated, the symptoms will start reducing. So the mudra for this would be the Varuna mudra, and the chanting would be VAM, VUM, VAM. VAM. The color we associate with this Swadhisthana chakram is the orange color. And the gland would be the gonads. Gonads glands would be the gonads and the dharam and Swadhisthana. Now comes the Manipurakam. This is the place where the navel, the umbilicus is there. These chakras are all aligned in the spinal region. So we have to think all these chakras in our spine. So coming on to the Manipurakam, the physical symptoms, when we see the digestive issues, whatever it may be, digestive issues or diabetes, especially back pain, middle back pain. Here, this area, when we have some catch or any back pain in the middle part, this chakra would be correlated. And when coming on to the emotional part, we would we can think about the anger, excess of anger or egoistic nature. All these things would get covered in this Manipuraka chakra. Even the lack of confidence and the lack of determination can also be seen if there is any obstacle in this chakra. So how can we overcome this? So we can use the mudra, Samana mudra for this, and the chanting would be RUM, rum. And the color would be yellow color, just adjacent to this navel point, and we can start chanting rum. Rum. Okay. So the organ we associate this with is the pancreas, endocrine gland. And the plexus is the solar plexus. So all these are just subjective things, but it can be correlate with all the symptoms we see in each individual. And then comes the very important chakra, Anahata Chakram. Most diseases, when we see, it mainly occurs in the Manipuraka and all the lifestyle then. Yes. Yes, sir. Shall I proceed?
Means only 5-10 minutes to conclude.
Okay. Yeah. Yes, sir. I'll just make it still a brief thing. Okay. Then comes the Anahata Chakram. Yeah, the Anahata Chakram is correlated with the cardiac region. So the mudra, the first the physical symptoms is like the obstruction in the coronary arteries and all the dyslipidemia related things, and any lung related things also we can correlate with this. And emotional part, this is the very important thing I like to highlight here, is the relationship issues, the love giving and love receiving. When there is any obstruction in this, definitely the Anahata Chakram would get obstructed. It is not only with the diet part, it also has its importance in its emotional part. So this chakra especially has two mudras to be done. So for physical heart functioning, this is called the Apana Vayu Mudra. Of getting an angina, our heartbeat can be again revived with this mudra. So I especially want every individual, not only the doctors, every individual to practice these kinds of mudras to save anyone's lives. So this is Apana Vayu Mudra or the Mrita Sanjivani Mudra, and the chanting would be YUM. And we can correlate with the green color, and the gland would be the thymus gland, and cardiac plexus can be related to this. So I'll go with this. Yum. And this is for the mudra. So this is the chin mudra or the jnana mudra. When we keep the right hand on the left side, that is on the heart region, the other hand on our lap. This is called the Purna Jnana Mudra, and this heart function. Yum. This mudra actually spreads the positive vibrations around us. So whenever there are any relationship issues, in our life, when we bija mantras along with the mudras, respective mudras, definitely we will see a lot of changes in our life. So then comes the Vishuddhi chakra. Here the throat. This the physical symptoms are the thyroid issues, any speech related issues, or any even the cervical spondylosis. All these comes under this Vishuddhi chakra. And the emotional part is when there is any, when the freedom of speech is curbed in any of the individual, definitely there would be imbalances in the thyroid functioning. Actually, all these things I am seeing in my patients in my regular practice. That is why I'm telling all these things very staunchly, that along with lifestyle modifications, diet, yoga, these mudras and chantings really plays a wonderful role, and especially these thyroid functioning, because TSH level around 30 has come down to 18 in one of the health seeker. and we are using it regularly, but this was a very peculiar case along with, because why I like to express these views is that we see any individual only in a physical entity, but all the other factors here plays its role. Here, the freedom of speech, when it is curbed, automatically the chakra gets blocked and all the hormonal imbalances occur. So the mudra for this would be Shankha Mudra. The chanting would be hum, H-U-M. Hum. Mm. The color we correlate is the blue color, and the gland would be the thyroid gland. Then comes the Agnya chakra in between the two eyebrows. So for that we use the physical part is generally the insomnia. Mainly nowadays we see a lot of insomniac health seekers. So insomnia and headache. We see a lot of cases related to headaches, whatever headache it may be. These practices definitely brings down, and there are specific mudras for each and every symptoms also. Mahashiras mudra, all these things also come under, but specific mudras for each chakras I am concentrating now. So for this mudra would be the Hakini mudra. By doing this Hakini mudra, both the hemispheres of the brain would get activated, and we'll keep the thumb over here and start visualizing the tip of the nose and start chanting AUM, Aum. Aum. And the color for this would be the indigo color, and the gland would be the pineal gland. It is a very important gland, as we all know about the importance of it, the melatonin hormone. So as we start doing all these practices, the tripods, as the Dr. Sriharsha said, the tripods, the Nidra has its very significant role in the tripod. So when that comes in a perfect manner, all the other two entities will come in the perfect manner. Here for the Nidra, I would emphasize on a point that 11 p.m. to 3 a.m. definitely an individual needs a proper optimum amount of sleep, because the gallbladder and the liver meridian is very active during this time. So our body definitely needs rest during this time. And 3 to 5 is lung meridian, so pranayama can be done. 5 to 7 is large intestine, so excretion can be done. 7 to 9 is the stomach meridian, so the breakfast can be taken during this time. So the complete rhythm falls the sleep pattern. So 11 p.m. to 3 a.m. would be our sleep timings. So this comes for the Agnya chakra. Then at last comes the Sahasraram. For this, the mudra would be Chin mudra. Again, I like to emphasize, most of the people would do like this. This is the Vayu mudra. Chin mudra is here. This point, we would keep our index finger here, because this is the pituitary and the pineal gland point. Mainly the pituitary gland point is here. So when we start, not much of a pressure can be given, slight pressure, and the other three fingers very much relaxed. And when we keep our hands like this and just go to bed in the supine pose, automatically within 20 to 30 minutes, a good quality sleep would be attained. And we have seen, and we are seeing this excellent, wonderful results with this mudra in most of the cases. So we can all start using these kinds of interventions along with lifestyle modifications, diet, and medicines, and all these together conglomerate to give the actual holistic treatment. This is what my opinion is. And as I already said, and I am going to end my speech. Just two important tips I would like to give to the upcoming generation is about the shower bath. Shower bath, in the Eastern people, we always try to take bath in the ponds. So here the chakras, I would like to emphasize on the chakras. So the water level comes from the Mooladharam, Swadhisthhanam, and then finally it comes to the Sahasraram. But in the shower bath, actually, the water directly falls on the Sahasraram. So what happens is the body temperature and the surrounding temperature is very much high in the eastern part. So when we have that shower bath, automatically the heat just goes inside the body, and again lot of disturbances occurs. So this is suitable only for the Western people, and the Eastern people, we can go for the bath from the lower part. For the Western people, the surrounding would be very cool, so they have to keep the warmth inside the body. So for them, the direct Sahasraram shower bath is indicated. And then the eating pattern, sitting down and eating would activate the Manipuraka chakram, and the digestion part would increase, that ability would increase. So all the activities what we are doing correlates with the 7 chakras, and once we start feeling it and enjoying it, we will never get away of all these practices. And I hope, and one more thing finally is the Brahmari pranayama, that also enhances a very good focus, concentration, and increases the academic performance. And I don't know whether I can go with it as the time runs off.
Time
So,
is over, madam.
yeah, okay. So with this, I'll end with a prayer as usual, sir. Asato ma sadghamaya, tamaso ma jyotirghamaya, mrityo ma amritam ghamaya, sarvesham shantir bhavatu, sarvesham purnam bhavatu, sarvesham mangalam bhavatu, loka samasta sukhino bhavantu. Om Trayambakam yajamahe sugandhim pushtivardhanam, Urvarikamiva bandhanat mrityormukshiyamamritat. Om Shanti 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 Hari Om Shri Gurubhyo Namaha Hari Om. Yes, sir. I really thank everyone for listening with patience and giving me a chance to express my opinions. And again, happy World Health Day. And if any queries, I'm ready to answer it at the end of the session.
Thank you.
Really, thank you so
you.
very
Question
much.
and answer session will be last.
Thank you, sir.
Thank you. Now I would like to request Basavaraj Tubaki ji, Professor and Head Department of Kai Chikitsa, KAHES BMK Ayurved Mahavidyalaya, Shahapur, Belagavi. Welcome, Dr. Basavaraj ji. Welcome. Madan sir.
Pavanji, thank you very much. Thank you. Hema ji, thank you very much for your wonderful presentation. The connections that you have shown between the chakras, mudras, bij mantra, and the color connection. I will leave all the questions because we have for later, because we have Avdesh Pandeyji here, who's very interested, also very interested in the pineal gland and some, so he will also have some questions. So we won't delay Basavaraj from his presentation. We will keep our comments for later. Thank you very much for being with us, and thank you for this wonderful presentation. I have put one question briefly just to indicate the direction in which some of our discussions will go. So please stay with us, Hema ji, for after Basavaraj. Thank you. Thank you again for the.
Good evening, one and all. Is it audible, sir?
We can hear you, Basavaraj.
Yeah,
we can hear you.
I have a slide.
Please also just share in a minute about yourself a little bit, about how busy you are in Belgavi and how you came to Belgavi, etc., etc. Thank you.
Sir, I have a slide to present. Can
You can share it using the share screen button. On the bottom of your screen is a share screen button. If you activate that, you will see all the, if you have many screens open, then you can oh, there it is. It's coming through. Thank you, Basavaraj. Again, we have the same possibility of having you display your screens in the presentation mode. If you can put it on the presentation mode, that's beautiful. Thank you. How did you do that so easily? Thank you very much.
This can be done easily, sir. Some problem is there
Okay.
with presenters. Welcome.
Thank you. Thank you, Basavaraj.
Yeah, thank you, sir. Good evening to one and all. At the outset, I thank Pawanji sir and Madan sir, and also I would like to thank Dr. Sriharsha Shetty sir for recommending and introducing to this August gathering. And so once again, good evening one and all. Without wasting much of time, we'll just look into the topic. I am Dr. Basavaraj Tubaki. I did my BMS from the same college, that Keli BMK Ayurveda College, Belgavi, and did my master's in Department of Chiropractic from SDM College of Ayurveda, Udupi. Then later continued with the PhD from NIMHANS, National Institute of Mental Health and Neuroscience, Bangalore. And later, so with the 2 years, the fellowship course, there's a Vaidya Scientist fellowship course where Madanji was our mentor, and we had very good interaction. And post that, I'm working in Keli Hospital College, so where I am the head of Department of Chiropractic, as well as I am the head of Department of Neuropsychiatry unit in hospital. And so we are doing a lot of clinical services as well as research, and to possible action beyond the publications. And we have also introduced the whole system research institutes, and we have which is the topic of the current day. And we have a few of the publications they are under the advanced stage of review. So this is a brief the information I would like to provide about myself. So I think with this we'll go ahead with the presentation. So Madan sir, if there is any issue with the slides movement or voice,
it is looking, you are on the opening slide. Please let us have the first slide.
Yeah.
Okay, there we are. We have. Wonderful. Thank you, Basavaraj. Thank you. Very good.
Yeah. So
thank you.
I would like to So I'd like to thank my previous speakers, Dr. Sriharsha and Dr. Hema Malini, for bringing a lot of innovative and information regarding the holistic health and making my presentation also a bit easy. So the contents includes sir, the pointer is visible?
We can see it clearly. Thank you. It looks very nice. Thank you, Basavaraj. Pointer is visible. Yes, pointer is visible, and we can see your slides clearly. Thank you.
Hello? Yeah, sir. Yeah. So brief. Yeah. Yeah. Thanks. So again, the contents of my talk. So what again, by looking into holistic approaches and Ayurveda, and so what I look into was, so first we'll just briefly look at holistic health, and without again which are the, and we'll just look at holistic health and Ayurveda. So how is the holistic approach have been embedded into the field of Ayurveda? Maybe looking into various fundamentals and pharmacological angle, diagnostic angle, preventive medicine, and application of this holistic approach in Ayurveda. So through preventive medicine, treatment, spiritual meditation, and the research. So yeah. So as again, just a glance through the fundamental dimensions of holistic health includes physical, psychological, social, and spiritual domains, as well highlighted by the previous speakers. So where the body, mind, spirit, and emotions are. So this holistic health believe that whole person is made of interdependent parts, and if one part is not working properly, all the other parts will be affected. So it's not just the again it's the assimilation of the different parts. So the some of the addition of the parts doesn't make this whole part. So because there is a lot of complexity involved and hierarchy involved, so like the parts doesn't, so the addition of the part doesn't make the whole component. The whole component or the system biology is a bit different from, so what is the current day biological perspective of looking into the reduction approach. And when you look into the holistic health, so like what you look into is, so it incorporates the inputs from individual health, and maybe like again we have the economical health, environmental health, familial health, social health. So you look into the principles of Ayurveda. So where it has given the approach and dimensions for all these components. So where, so like these are, so like there's an interrelated, they are integrated, and there's a, maybe like I can say there's a crosstalk between these components. So what is holism? So concept laid down to general systems theory by 1971. The concept of systems being more than the sum of its parts leads to complexity and chaos theories. Stress importance of non-linear relations. So minor changes in one factor may have a major effect elsewhere. So this is what maybe like goes in sync with the Ayurvedic philosophy of understanding. We look into when it comes to Ayurvedic Siddhantas. So where, so whole, the maybe universe, body, etc. is very much in sync with each other. So holistic principles. So all people have a innate healing powers. The patient is a person, not a disease. Healing takes a team approach involving the patient, doctor, and various aspects of the practices. Treatment involves fixing the cause of a condition, not just elevating the symptoms. And if you look into what are the types of holistic medicine as per the US, etc. So where we have a website, so where the holistic medicines and the the registered practitioners have been listed. So which says that the patient education on lifestyle changes the self-care to promote wellness. This may include diet, exercise, psychotherapy, relationship, and spiritual counseling, and more. And the complementary and alternate therapies, so which have an integrated component of holism in their whole, like whichever complementary camp therapies you look into, maybe like Ayurveda, acupuncture, the chiropractic, homeopathy, etc. So they have the philosophically, the philosophical component of the, or theory behind, component of these systems is the holism. So where, and even the holistic medicines in the Western, so like again, they incorporate Western medication, surgical process wherein required. So that makes the whole component, whole package for the medication as per the US. So there's a slight difference between integrative medicine and holistic medicine. So like when you look into there is a definition by the American Board of Integrative Medicine. So the integrative medicine is a practice of medicine that reaffirms the importance of relationships between practitioner and patient, focus on the whole person, is found by evidence, and makes use of all appropriate therapeutic approaches, healthcare professions, discipline to achieve optimal health and healing. So the difference is here. So like the integration, maybe it can occur within systems or across systems, where it takes the best component of each, maybe through what is the evidence. Currently, the meaning of the best component is the evidence. So it takes the best out of all these components and makes a protocol or integrated approach. So the integrative medicine is to take the best of all these components. And the holistic component is, it goes still beyond that. We'll just look into the coming slides. And even, so we have a holistic health status question is being again published, and so which has the various components. So like when you look into these components, like it has a psychological expression, change in self and family, physical symptoms, social family connectedness, fatalism, that is philosophical, religious and faith, self-query, and coping styles. So these are the 8 domains through which the question is again made. So where the psychometric properties have shown that, so it has a lot of, so like again, scale is has a lot of reliability and validity. And these are the basic aspects of the holistic health. And what goes beyond, so Ayurveda medicine and the current conventional medicine is, so Ayurveda medicine as a part of even the CAM system of medicines have a holistic approach, and it has a reduction approach. So it has a body, mind, spirit integrity. So it is known, so there's again compartmentalized. Life and health oriented, so it's a disease oriented. Patient centric, it is a disease centric. Diet and lifestyles are oriented, drug surgery oriented. Pro nature approach, not necessarily. Biotherapy, green pharmacy are the major components of its approach. It's a chemotherapy. And especially current day, it's more again being widely used for the chronic and metabolic and psychosomatic disorders. And so one of the major advantage of the current biosystem biomedicine is the emergency medicine infections. And here it looks at disease prevention, health promotion. Here it is diagnostic and surgical interventions. So maybe like again here, when you look into studies, it is a high safety level on the basis of adverse effect profile or even a toxicological profile, frequently unsafe, and so like it is considers efficacy is like in soft and nutraceutical. So here's efficacy is high, and cost effectiveness again it's a questionable and a high cost. And when you look at the evidence level, there's low level of quality assurance, evidence-based research funding, etc., and it's better. And of course, these are the old data of the budget allotted, where the budget allotted in India for the issue is very meager compared to the contemporary sciences. So this is all about a brief of the holistic component. So when you look into Ayurveda, holistic health management is so like again, Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ta Kashchid Dukh Mahagya. So where we look into that happiness pervades everywhere. And with this, we'll just look into Ayurveda. So again, like already we look into this, the holistic approach of the health. So where you are dosha, agni, dhatu, prasanna, atmendriya, mana, swastha, which all we know. And health definition goes like again, we have physical, mental, social well-being, etc. And so when you look into this, so the health, so like Sharira, Indriya, Sattvatma, Sanyogadari, Jivitam, etc. When you look into the Ayu definition, so it's an integration of, so like again, we have the integration of the Sharira, Mana, Atma. So like again, that is the Ayu. So like all these three components plays a role. And so look into, in the coming slide, look into how the soul also has a contributory role. And when you look into definition of Ayu, so as like we have Hitayu and Ahitayu, Sukhayu, Asukhayu. So what does this Hitayu, Ahitayu in relation to the holistic component? So it has like Hitayu, Ahitayu is psychosocial, psychospiritual relationship. Sukhayu, Asukhayu is mind-body relationship. So when you look at Sukhayu, free from Sharira, Manovikara, and with all maybe like Rasayana effects like youth, strength, virility, reputation, etc. And Hitayu is maybe like well-wisher of all creatures, honest, peace-loving, dharma, artha, kama, jitendriya, respecting elders. So like where scholars did, and we have Smritivan, like which are the maybe like the apta. So Hitayu is again is beyond the current definitions. So where not only just the body, mind, and atma, it goes beyond. So like again, looking for well wishes for all the creatures, living organisms, and peace-loving, etc., etc. So this is the major holistic approach of Ayurveda. And when you look into the understanding of like the person, so when you look into health, so it has a very physical domain. Again, no need to elaborate that. We have a lot of biological, neurological, endocrinological, neurophysical, biochemical, which are the components of physical health. Similarly, we have like a cognitive health component, thoughts, process, informations, solving problems, etc. And we have affective domains, emotions, and we have behavioral, unique personality, and we have social. All this together forms the holistic approach of health of the individual. Similarly, so when you look into this, so we have a Sukhayu, and maybe like when you look into so when you look into this, the health persons, so like we have the individual person, and outcome is again, so this not only it depends upon not only the individual about his biology or his mana, atma, or buddhi, etc., even the social perspectives, and along with that, so we have the purusharthas. So for which the person interacting, that is needs and objectives like dharma, artha, kama, moksha. So he is going to interact with the environment. So for this purusharthas, and the outcome may turn out to be, if it is satisfactory, Sukhayu, and if it is not satisfactory, Dukkhayu. So like again, so like individually, along with the interaction with the environment, can lead to different outcomes. So this also like again defines our health. So when you're looking into the health, so we have to look into this domain also. So looking into fundamentals. So like we just look into a few of the fundamentals where how the fundamentals have been taken from the holistic component. So like again, we'll just glance through Sushti Utpatti Krama, Purushalok Siddhanta, Padartha, Samanya Vishesha, Panchamahuta, so Sharira, Mana, Atma, Dosha, etc. So we'll just look into, we'll not go into all the details of it, but we'll look into how is that so these fundamental Siddhantas have incorporated the holism in their understanding. So like evolution of the universe, again, Ayurveda follows Sankhya and Vaisheshika philosophy, in which we have Avyakta, Mahan, Ahankara, and where we have the gunas. So primary gunas, Sattva, Rajasika, Tamasika. So which we can explain in the current day, again, the physical and metaphysical properties like equilibrium, kinetic energy, inactiveness, and so on. So for which we have Dhyanendriya, Karmendriya, Tanmatra, Mahabodha, etc. So like again, from the universe itself, so led to development of the gunas, and that to gunas of Indriyas and to the Mahabhutas. From Mahabhutas begins the journey of the body. So like again, this from the Sushti Utpattikrama itself, we can understand that. So like again, how from the whole or from the universe or from the, so like again, cosmos, how the body get into, it's like how the body is formed. So that is a holistic angle of it. Similarly, when there's one of the major is the Purusha and Lok Siddhanta. So human being is a part of macrocosm or environment or nature. So constituent of humans is of nature. So like again, we are the small part of nature. So which are the Mahabhuta. Principal natures are to be followed. So when you look at this, so like we have looked into the, so the Sharira and Asharira. So like climatic changes, seasons, diurnal changes, behavioral, so like again, wherever the external, so like external, there's a modulation that maybe positively or negatively affect our health. And so going against nature cause pathology. So treatments lies in nature. Like again, we have, like similarly, you have been explained like, so Vata is compared to the air, Kapha to the Soma, there's a moon, and Pitta to the Surya. And we have the components of Mahabhuta, and similarly, so like mud, sunlight, water, heat, therapies have been used. So animal behavior, like observed, like vomiting by dogs, etc., Omana karma, fasting, resting. So have been used as a maybe experience-based or observation-based components and imbibed into the philosophy of Ayurveda and made it more applicable. So like again, so these components Purusha and Loka. So the Purusha is a subcomponent of Loka. So what is happening outside is going to affect inside, and even inside component can also affect the Loka. So like again, all the human behavior can affect the Loka. We can see a lot of, again, various kinds of environmental disturbances. That is because of Purusha. And they are going to be in sync with each other. Any disturbance elsewhere going to affect. And so when looking into the our health, so we have to look into the Loka component also. Similarly, we'll just run through the Padartha, so where Dravya, Guna, Karma, Samanya, Vishesh, Samaya components are there. So where they look into the holistic purpose, like again, when you look into Dravya, so like again, the Mahabhutas, like again, we have Prithvi and Kala, Dik, Atma, Mana, have been also considered in considering making of Dravya. So like whole our body is made of Padartha and Dravya, and these have been the holistic components. Similarly, so this Samanya Vishesh Siddhanta have been incorporated. So this is especially applicable into the physiology and pharmacology, where Samanya similarity cause increase and dissimilarity cause a decrease. So applicable in physiology, like even sunlight, like the Asharirika. So like we have even the doshas, Vata, Pitta, Kapha, Sharirika and Asharirika. Sunlight increases the Pitta, Agni, and so we are looking into how the Loka affects the Purusha. So pathologic excess hot drugs cause Pitta Vyadhi. So on the basis of the Nidanas, treatment similarly is antagonistic. So like again, these all the principles again incorporates. So the holism in this component. Similarly, we are just looking into the Mahabhutas. So where, so like Sarva Dravya is of Mahabhuta, and so like we have the Prithvi, Tej, etc. And this also have the, so like again, this is the Mahabhutas, which so we can compare to the current day understandings from physics and metaphysics. And coming on to the Dosha, Dhatu and Bala. So doshas and dhatus and balas are in turn for the Mahabhutas. And these Mahabhuta in turn have a gunas. So gunas are the fundamental or basic substrates of any organic or inorganic substances. So like again, these gunas, so like again, which you are looking at it, maybe like again, so these gunas contribute to production of the Mahabhutas. And this Mahabhuta, so like again, in the biological system or in the maybe living organisms, produce the doshas. And similarly, so we have the production of the Indriyas on the basis of the Mahabhutas. And similarly, on the basis of the Mahabhuta itself, we have the Dhatus. So how this again, so the whole take-home component is, so like again, Loka and Purusha or the holistic component, what you are looking is through the Mahabhutas, and that is propelled into Dosha, Dhatu and Mala. And so integration of all this, so like again is Sharira, Mana, Atma. So Sharira is physical body. So like again, where we have a treatment like Yukti Apashya and Mana psychology component through Sattva, Atma, maybe you can consider as a biological force or deep unconscious mind. So which produces the, so like again, biological actions in any substrate. So we look at Devi Apashiksa, divine therapy. And Ayurveda believes in Punarjanma. So like again, so like Karma Phala and Rajatam Anubandha. So like again, Ayurveda believes in Punarjanma, where so on the basis of, so whatever the Sharira and Manistic action will affect the Atma. And so this Atma, so when go to next Punarjanma, so it will take up the Karma Phala, results of previous birth, Sukshma Sharira. So it goes beyond the current domains, so in which it relates to two organisms through the component of Atma. And of course, we have Samadhi. So like samadhi in Ayurvedic perspective, so like Vishaya Alapatapam. So like again getting detached from Sattva, Raja and Tama, and of course the moksha. So there's again the Ayurveda believes is like again integration of Sharira, Mana and Atma and Punarjanma and Samadhi. So we had looked into this. So there's again all this dosha, dhatu, mala, agni. So how again being produced because of the Mahabhutas, and these are because of gunas, and through the guna, so it's going to interact with Lok and Purusha. So whatever the gunas, ahara, vihara, etc. we take, accordingly that gunagata say body biological substrates like dosha, dhatu, mala, so either samanya or vishesha, they're going to increase or decrease, and that way there's interplay. Similarly, when you look into the holism of the manas, so how the manas, so when you look into this, so like again, we have the physical level, like we have various kinds of doshas, vata, the panchavata, panchapitta, panchakapha, and we have dhatus. So again, there is again, so the feedback and it's a complex interaction between the manas. So like how we have the various kinds of prana, udana, have the manasika lakshanas on the manas. Like Indriya, and so like again Indriya also, Dhyanendriya, Karmendriya, Indriya, Buddhi going to interact with manas, and we have the gunas of the manas. So like again mana, sattva, raja, tama, the three gunas, and they are going to interact. And so the other component of manas is buddhi, the smriti. This is at the mana level, and at a metaphysical level we have atma. So like again in Charaka Sharira we have adhyatma guna, ichcha, dvesha, sukha, dukkha, prayatna, buddhi, are the gunas of atma, so which are displayed through manas. So and so this way the manas, like again here we are looking into Sharira, physical level, Indriya level, and manas level, metaphysical level. So they have a complex interaction with each other at both the physiology and pathological level. So this is required when we want to correct the pathology also. So like again, where we take the help of all these components in containing the, so like again, so where this part, any dushti of one part can affect others. And so like if you want to correct one part, maybe you are taken into account of other components also. Similarly, we have the rasas, again, the same rasa and gunas. So on the basis of Mahabhuta and gunas, and virya, vipaka, prabhava. So again, all, so having pharmacodynamic activity and vipaka absorptions and prabhava, etc. have been told on that angle. Similarly, when you look into the concept of the personalized medicine, so there, so like the holism is getting into, like again, though we either believes in holistic approach, it takes into the personalized medicine. So where it assesses the prakriti, vikurti, pramana, sara, samana, satmya, sattva, arshakti, vayam shakti, vaya, and by looking into this, so like again all the complex domains, it takes into make the person personalized approach, a customized approach. And similarly, when you look into the mental health, so like Sattva Pariksha, so we had, so like again, we can take up this link and look into the YouTube video where we had looked into this holistic integrative and the complex component of Sattva, how we are going to clinically examine that Sattva Pariksha. And we have one more publication on, so like again, the case study on Ayurvedic management of major depression disorder. So where we had looked into the various angles, like we had looked into Yukti Apachiksa, where we had done various Panchkarma, Shamana, and Sattva, and counseling and integration of all this led to the improvement. So which is one of the angle to which look into. And when you look into the classification of disease also, so this is holistic, that is again, so disease can be Sharirasthana or Manodhisthana, Ubedhisthana, and Ubedhisthana can also be Manasharirasthana, so in which, so psychosomatic or somatopsychic disorders, and Atmaja or Karmaja Vikara, Daiva, and even when you look into Janapad Dhamsa Roga, so maybe like again, where the community is disturbed, so Adharma, Desha, Kala, Vayu, Jaladushtis are going to produce a Janapad Dhamsa. So where, so like again, the environment factors, or so like again, Adharma because of Prajnaprada by the living organisms, and even environment factors can produce the outcome of Janapad Dhamsa or the, so maybe like pandemic, epidemics, or anything that disturbs the community. Similarly, when you look into the holistic perspective of preventive and promotive medicine, so like again, Vikara Anutpadana, maybe like preventive and positive. So we can look into this. So Ayurveda played a very important role. So like again, where preventive promotive medicines that is applied through various concepts like Patya Haravihara, maybe like Acharasayana, Dinacharya, Rutucharya, Sadrutta, so like Naishtik Chiksa, avoid Upata, Prajnaprada Varjana, and Atmadhyana, Dharani Vega, Yogya, Ayogya Vyakti also. Socialization and social health also being included, and Rasayana. So like maybe you can consider the epigenetics. where behavior and environment affecting the genes without modifying the genetic material. So by the behavior and environmental factors, we can still produce affect the genes and produce the desired outcomes. And when you look into Achara Sanas, so like again, so Achara Sana again being so now currently widely again used. So we just run through like again advocates truthfulness, free from anger, devoid of alcohol, peaceful, pleasing in speech, practice of japa, so cleanness in thought, etc. Practice of charity, regular prayers to gods, cows, and maybe like in Brahmana, etc. And even the world, free from barbarous acts, compassionate, regular periods of awakening and sleep, habitual take of milk and ghee, free from ego, good conduct, and love for spiritual knowledge, control over senses, reverence to elderly, etc. etc. What does all this say? So it explains a code of conduct. It advocates the individual conduct. It advocates the moral values. It advocates ethical values. So it looks at spiritual domain. It helps the mental health hygiene, physical health hygiene, social conduct, professional domain, environment factors. So if you are addressing all this, then only we are going to get, so this achara, so like again, achara that is behavior, all the practices is going to produce the sign and produce the maybe like dirgham ayu, etc., longevity and so on and so forth. So these have an important role in prevention prophylactic. So it's helpful in both the somatic disease and manasika vikaras like mana buddhi, bhakti, shila, chesta, achara, vibrama, ashtavibrama, and it's going to produce a positive psychology. And even it's going to help in atmaja vikara, that is karma vikara, so where the yoga chicksa is there, and satma to human society, and even to satma to the whole nature and environment. Similarly, Ayurveda explains about in Charaka Sutra 7, Yogi Vyakti and Ayogi Vyakti. So again, for socialization, who is the right person, who has the right character features for whom you have to conduct the socialization, and where you should not go for socialization. Like who is sinful speech and mind, backbiters, quarrelsome, sarcastic matters, etc., etc. So who are more rajatama, etc. So again, they who are devoid of rajatama, who have more of sattva, so they can be considered yogi vyakti. Similarly, opposite of this. So again, ayogi vyakti. So whenever there is a dushti of as a company of matured, acquainted, human nature, devoid of anxieties, well behaved. So righteous advocate hearing. So again, that's again. So it's a yogi vyakti here and ayogi vyakti here. So just again error in typographical error. So by this, what look into is by looking into this guna, when you are making for our health also. So to maintain our health, so you would look like again our socialization is very important. And to what kind of socialization? Again, they have mentioned the various character features. So to that character features, we can maintain our health by maintaining a proper social health. And so when you look at Yukti Shodhana, etc. So Ayurveda has again advocated various components for deciding Ayurveda treatment. Like again, we will just do not look into body components. So again, Kala, and again, so food habits, so mental health and habits, like even the habits of patients, etc. Dosha, Dusham, Bala, Kala, so etc. have been explained. So apart from the somatic and psychological components, we know that Shodhana and Shamana, we will not go in detail. And while advocating that, we look into dosha, dusha, kala, desha, ahara, satmya, and sattva. So we look into all that substrates. So like again, desha also like environmental factors. And what are the ahara? So that's again, what is the inputs he's getting from environment into the body, and what are the satmyas and sattva, and even look into the kala also. So this we are going to decide in making, in prescribe or in advocating any kind of the yukti of Chikitsa. And here also, like when you look into this play important role in deciding dose, maybe dosage forms, anupana, basic kala, patya, patya. So like again, when you are looking at this, we take the holistic approach in taking up these components and deciding, and finally ending up with this, with any kind of prescription. Similarly, when you look into this, so like again, we have the agantu. So like again, the graha, so graha bada, etc. been explained, and even so graha, etc. can play affect the body, and we can look into the agantu julmada where various kinds of graha can produce effect. Similarly, there are a lot of publications in which new moon, etc. have been shown to affect the body's mind and health. Similarly, we have researched this, so which can, so like to the planetary outcomes, we can produce various remedies. So this also one components where, so like in graha, etc., or maybe like again astronomical or even the factors which are beyond our earth can have a effect on the body, and through these drugs, so through this plant, we can take this approach. Similarly, we have Sattva-Jaya, we have in which Manonigra, Ashwasana, Pradanda Chiksa, Manukshobhana, Sadurtas, Samachitattas, etc. been explained. So which are the part of Sattva-Jaya. And when you look into Sattva Chikisa or Manasik Roga Chikisa, so apart from Pradnyapara, etc., so Desha Kala Atmadhyanam Saduttasya Anuvartam. So like we should know, we should be well aware of Desha, we should be well aware of Kala, and we should be well aware of Atmadhyana. So we just look to commentary where, like again, he has explained that. So like to be away from even Agantuja Manasik Vikara. So like Tyaga Indriya Upshama, Indriyanam Savishya Alapadatam. So you should be again, they should not have a Vishya that like we should not be too much attached to the worldliness. Smriti, that is, so like again, Puttadanam Vinashvattam Svabhavam. So like again, that is generalized principle where we have to understand that death of the sun is a universal phenomena, and by generalizing component we can accept. So again, or digest the death of the sun. So we can accept. And similarly, we have Desha Dhnanam iti Shunya Graha, Upasarga Graha, or Desha Varjanam. So we should have the awareness of Desha, which are good Desha, or which are bad, or which are not conducive, etc. So again, Desha Dhyana is very important for our health. Even Kala Dhyana, Paurnima Masya, etc., etc. You have to look into that angle. And Atma Dhyana, Swashakti, so etc., in which what are the abilities, capabilities, etc. So what we are trying to understand here, even for Agantuva Manasik Roga, so understanding the other factors, other non-body factors like Desha, Kala, etc., plays a key role in maintaining our health. Similarly, when you look at the Daiva Pashikasa, so you have Mantra, Aushidhi, Dharana, etc., which have been explained. So these have been explained in context of Daiva. So Daiva, again, so the Karma Jivkara. So Ayurveda also believes the Karma. We are looking at the Karma again. So we have, so like again, Karma of this Karma Janma or Karma of the previous Janma. So like we have Punar Janma in which Karma transfers. And to contain this Karma Jivkara, so again, we have to advocate Daiva Pashikasa. So again, in Sushruta, in Grani Achar Adhikara, he has explained what are diagnostic features to understand what is a Karma Yukara and what to be followed. Is beautifully explained, making very rational and logical. Similarly, again, when you look into this, so like again, holistic health and the spirituality. So Ayurveda advocates maybe like again, a lot of spirituality, etc. So what is how this spirituality has a biological value? So it brings a lot of positive values, attitudes, beliefs, and strength, including through spiritual practices. It brings a lot of well-being and happiness. Even there are a lot of studies showing that again, spiritual health practices strongly correlate with survival, low blood pressure, less remission time from depression, less number of cigarettes smoked per day per week, less severe medical illness, better quality of life, cooperativeness, and greater self-confidence, assertiveness, fewer symptoms of anxiety and depression, adjustment to dialysis and cancer pain, love for God will bring a lot of high self-esteem, self-efficiency, sense of maturity, less depression, greater self-rated health, and unconditional love, and most powerful stimulant of immune system, the love heals. So whenever you have, like again, maybe the love or the belief system, it's going to increase the lot of immunity, and that, so again, going to help in a long way in relation to the physiology and pathological. Similarly, so when you look into religion, so that is spirituality. So religion. So religion provides patients, of course, we are looking into the sattvic way of understanding the religion. So we are not looking to Rajasic and Tamasic understanding religion. So specific moral values, guide prescribed rituals that are helpful in holistic healing, love, compassion, care. Spirituality led to less depressive symptoms, better quality of life, less cognitive impairment, less pursued pain in elderly or patients. And similar spirituality and religiosity had a better quality of life in residual schizophrenia, increased resilience in high risk of major depression disorder, and also studies have shown that there are less so like suicidal ideations, suicides in the patients who are more spiritual. So patients with greater optimism, like spirituality and patients with more spiritual, have greater optimism, self-esteem, life satisfaction, less alcohol consumption, tended to be more spiritual. Spiritual activation, so modify pro-inflammatory cytokines, suppress progression of chronic disorders, etc. So there's a lot of evidences saying that again, though Ayurveda, so again, on the basis of the experience based or the clinical outcome based, the information have been incorporated. So current day studies have shown a lot of evidences in what we claim. That is the validity of so what has been recorded in text. Similar to again meditation. So in meditation, again, we will not look at definition. Meditation has a stronger role into health. Again, there are a lot of studies in yoga and meditations going all across the world. Reduction in resting value as well as ambulatory blood pressure result in cardiorespiratory synchronization, suppressed corticosteroidal glutamatergic neurotransmission, boost the immune response, decrease the level of so like reactive oxygen species, and reduction of stress, promotive positive mood health, etc. So like again, whatever we consider meditation, religion, spiritual, so these also have a stronger role in relation to health. And now coming to the holistic approach and the research. So again, we have on the basis of holistic approach, we have a design called the holistem research, and also we have the black box design. And it was coined in 2002. We will not go into the details of it, in which so it assesses all aspects of approach to treatment. So how it is done in the usual clinical practice, the same will be used in the research settings. But you know that research settings is a bit different from clinical setting. But in case of holistic research, so that has again it's not been compromised, because so these are the philosophical and clinical approach of the Ayurveda systems, which has to be incorporated in the even research scenario also to get the actual efficacy and effectiveness. Recognition of context, individuals are influenced by and response to their own interconnected ecological landscapes, focus on multimodal rather than single agent unidimensional effects, emphasis on individualized, non-standardized treatments, and therapeutic interventions are incoherently complex, synergistic, and independent. So because of all this, so the components, so like holistic research, so like again takes into the account and takes up that holistic approach into the interventional model and uses same component. Maybe it has a difference in maybe like again internal external validity, etc., etc. So that is a different component. And so again, it's very much debated in relation to the RCT is a standard biomedical model of the causality assessments. So randomized controlled trials, so which measures, so like again here, the like again, whole-term research approach looks into effectiveness. So again, how in the real-time scenario, the therapy is putting the effect. So it has individualized treatment protocols, not generally use placebos, assess a full strength of health gains. Similarly, we have another black box design suitable for traditional medicine camp. Treatment and all its components are intervened as in the clinical situation. No component of complex treatment is individually tested or isolated. Effect is tested within its own theoretical framework or within that of a conventional medicine. So where whatever we are using, so we have the baseline data and we have the complex treatment. So like we are not going to assess the components, but again the protocol standardization has to be done, and that full protocol will be executed, and we look into output. Maybe we have a comparator. Maybe like we have recently we have been conducting 4 to 5 studies with the whole system approach, in which one of the control arm is the standard, the gold standard control with the conventional medication, and the other arm is this. So like again, the whole system approach. So finally, again, I want to conclude, coming to last part, that holistic medicine and Ayurveda, these are the futuristic medicine, can play a vital role in preventive and promotive medicine. Need to generate evidences for the holistic medicine incorporating Ayurveda. So again, to convince to the current the science-based society, so where we need to develop a lot of evidences. So like again, here in the holistic medicine, especially disease management along the quality of life greatly improves, especially when you are applying to the chronic diseases. So where we have the quality of life. So like when you look into access classification of the, so like again, DSM classification. So quality of life is one of the axes. So like again, so like more, because of this, most of the patients are tracking towards the holistic and Ayurveda approach. So where, so this is chronic management, the quality of life is very much compromised. Holistic development can bring peace, prosperity, other than the health. So to humanity, living organisms, ecosystem, environment, and to the nature. So with this, I conclude. So any questions and suggestions are most welcome. Thank you, sir.
Great, great. Very nice presentation. Very nice presentation, Dr. Basavaraj. I will be troubling you again and again. Thank you, Dr. Madan, sir.
Thank you, Pavanji. Thank you very much. First of all, I want to thank all our 3 presenters for the wonderful presentation. I also am conscious of time, Pavanji. So first, having thanked the 3 presenters, I just want to say I've raised a few questions in the chat box. There will be many more questions from all of us who are gathered here today. We're very fortunate to have here with us Avdesh Pandeyji. And I don't want to miss this opportunity to draw Avdeshji into our discussion. I don't know if Avdeshji is still here with us or whether he has left us. I see he might have left us already. I thought this would be a good opportunity to draw Avdeshji into a discussion about what modern medicine sees, what practitioners of modern medicine see as difficulties in engaging with what was the kind of material presented today. As I don't see Avdeshji here with us, so we will continue with our with discussions. If there are any questions from the floor, I'll be happy to take this now. I invite Basavaraj, thank you so much. I particularly like the presentation in your second last slide about the input black box output. This is the kind of approach that we need to take when we look at complex systems. And all the discussions, all the presentations today touch on that, the need to understand how we can come up with new designs. And the reason why we talk about designs is because we need, maybe there's an opportunity to re-optimize some of these things. You know? There are many areas where you have correctly pointed out the difference between holistic health or holistic healthcare versus integrative healthcare. And there are many subtle messages from the Ayurvedic Vedic texts that are richer in many ways. And they describe many aspects very correctly. But somehow we are not able to convey this difference between integrative versus holistic health. Your presentation has many points that are very important, and I hope there will be an opportunity to refine this. As Pavanji says, we will have you back here on many more events. But that one point about holistic versus integrative health is very, very important. And it is very clearly presented in all the samhitas and the commentaries, like with the references that you have pointed us to. The other point I want to make, this related to the standardization optimization. Hema presented the connections between chakras and activation, the mudras and activation. When we use a term called activation, is everybody understanding this correctly? And this is a very, very important point. When we say activation, what do we mean? Are we talking about the better flow of prana? Is that correct, Hema? I don't know what it is that you're trying to, what is it that you're trying to convey? And three questions I have asked, a few questions I've asked to Sriharsha ji, which is, we see a lot of contemporary research. When we look at the contents of these contemporary research papers, like the 2 papers I've highlighted there, one from Switzerland and one from America, I don't see anything new in those papers. It's only revalidating. It's validating and revalidating what is already in the Samhitas. So we have a situation by which we have a lot of information, but we seem to find it difficult to present it in the contemporary language. And there is a lot of contemporary work that we are not connecting with. So I want to see if we can get some feedback from all our presenters on some of these issues, because it is clear that healthcare for the future will need the help, something new, something different. And that direction and that something different that contemporary medicine is looking for is already there in our samhitas and tikas, the commentaries. How are we going to connect these two things? There needs to be a bridging of something. I'm curious to see, because we are talking about the World Health Day, and we are talking about taking the richness of the messages in our samhitas to the rest of the world. And the rest of the world is unaware of what is in our samhita. So it's I think it's a very, very clear situation that even in India, contemporary Western medicine practitioners are not aware of what is in our Ayurveda, Siddha, Unani texts, yoga texts. So there are gaps at many levels. Within the country, we have gaps. When we try and take this knowledge and try and put it in a global platform, there are gaps. There are some promising initiatives, like the new initiative, the Global Health, the Global Center for Traditional Medicine that is coming up in Jamnagar. It's a small initiative, but an important initiative. We need to do much, much more in this space. I want to see if there is something more that we need to do. So to maybe start with our speakers. Sriharsha, what do you think? Where are we? You've given us a lot of wonderful insights. You have a very good understanding of the commentaries and the primary texts. How do we make this bridge? Do you have some experience maybe in Bangalore, enlightened city, where there is already the Transdisciplinary University and Indian Institute of Science and other campuses there? Have you managed to make these interactions happen? Is there something else we could do to speed up the process of alerting people to the wealth of knowledge that is there in our texts? Sriharsha ji, Hema ji, whoever wants to take this, Basavaraj ji, what is it that we can do to excite our students to engage with this point, to see the big picture, to see the global
people who are
Thank you, Sriharsha. Would you like to? Can you hear me? We can't. Sriharsha, we can't hear you. Basavaraj, would you like to address this? I think there is a communication problem.
able to hear me, sir?
Well, okay, we can hear you now. Thank you.
Yeah.
Thank you.
Yeah.
Do you see what I'm trying to see, Sriharsha? We have thousands of years of such amazing literature and very implementable, very practical suggestions, but we are not able to scale this. What is the way out? Sriharsha ji, can you hear me?
So can I?
Please, Basavaraj, please. Yeah, we can hear you.
So there are a lot of information available in text, which we are trying to put in the real practice. Like say example, of course, during COVID also, our hospital executed many components. And from research point, from my perspective, so we have since last 5-6 years, so we have brought this whole system approach in our study designs. So we have already executed around 4 to 5 projects. So like, of course, they are thesis level. And I think 2 are in advanced stage of review in on a few of the international, Scopus-based journals. And so like we have made a protocol. So like again, we're looking into clinical scenario in which how we think algorithms, how we think in a clinical scenario, maybe like again, and that we made a process. And we did the validation with the inputs from different scholars in-house and out-house. And with the existing resources, with the existing drug, we made that protocol. We made 2 protocols. One is the diagnostic protocol, how we are going to diagnose, like again, in the ways of algorithms, and treatment protocol on which, so for each diagnosis, how we are going to do. And for that, in one arm, we did this whole system approach. And in second arm, of course, it was a randomized control trial. So randomized control trial, in each one was the whole system component, in other was the gold standard control. So like that way, so like again, we have to look into the whole system into the component of the research. And similarly, so like again, maybe like again, the Dhuma. So like again, Dhuma, so with various kinds of Rakshogna drugs. So like again, have been explained in Komorbidya and Kashyap, etc. So this has been executed in our hospital as well as college. So we had again, heating chamber in which portable, which daily 2 rounds will be taken in entire college and hospital premises. Earlier it was, before COVID, it was only for the Garbhini and Thiroga Prasuti and Komorbidya, it was been executed. With the COVID, it has been executed in all the chambers, etc. So this way we are trying to bring out, so what is explained in text and try to execute. And with the available infrastructure and funds, we are trying to generate a few funds also. And also like additionally, I want to inform that, so like again, I am the editor-in-chief of the University Journal of our KLE, that is, we have Indian Journal of Ayurveda and Integrative Medicine KLE. So I am the editor-in-chief of this journal also. So we are trying to generate, again, help the people in getting a lot of evidence in relation to the Ayurveda practices. We are encouraging, of course, with our whatever possible resources. So that way, so I hope I am addressing to the point raised, sir.
Yes, Basavaraj, thank you for taking the question and pointing to some of the work that you're doing. I have put on the chat box 2 of your wonderful papers, and the links to it. One is on Ayurveda management of major depressive disorders and the case study, and the second one is Brahmivati in generalized anxiety disorder. Okay. Now, this is knowledge that is coming these are the studies based on knowledge that is coming from the Samhitas. Now, if we accept that this is irrefutable, okay, so we have a logic for using Brahmi for these studies. I think Suhash Shetty presented this at the European Congress for Integrative Medicine in September here, Brahmi and Brahmivati for post-COVID sleep issues and related things. Now, what I'm saying is that you already have the knowledge. All of you, 3 of you, have presented some information that shows that we have the knowledge and we know that it works. The next step, how do we take it out to the world? Don't keep doing those clinical trials. Suppose we agree that it works. I think Agnihotriji will join us in giving us some thoughts, but I just want to I want to push you a little bit to say, how are we going to take it to the next step to tell the world, go to America, go to Australia, go to Brazil and say, look at this works, please.
So can I say? Or
please, Basavaraj, please.
Sir, yes. So again, yeah. So if you look into browse, recently we have published, we are doing a very good job, our department, Kai Chicks department, I am working since last 10 years. So I am observing that all the staff, etc., were doing a very good job in portal hypertension with liver cirrhosis, in a decompensator stage. And so we have been looking at data. Then, we can browse through liver cirrhosis and publish in JM retrospective cohort study. So where the real-time practice, how they're using, we analyze thoroughly, and the existing the scientific component rigorously. So we have come to the paper where, we analyze the thought process of around 7 to 8 consultants who are doing very well in that, and we made an algorithm. And how is that they change the medication, etc. We analyze critically, and we brought in all the paper, and we brought the evidence. And through that evidence, so there are many calls coming by looking into that evidence, like can we approach a hospital? So that way again, so even few of the international clients also had called because of COVID and other issues again. So things are in process. So what I'm to say is, so what the holistic approach or what the real-time practice, so we are getting into evidence and getting into the world. Thank you, sir.
Thank you. Basavaraj, you are very special. I'm going to ask 1 or 2 more questions, if I may. Your PhD was done at National Institute for Mental Health, NIMHANS, very important, prestigious institute. Your PhD was on the efficacy of Manasamitra Varakam.
Sir.
Yes, and
yes, sir.
Now here is the difficulty I'm going to present. This is slightly outside the context of today's direct presentation, but your PhD was on a very important formulation that has been on the news with a negative press. And I'm raising this question because we have Domaji here from Telangana, who says that Manasamitra Varakam should not be given for young children. And there was a case recently in Australia where one Vaidya was struck off the register. He is not permitted to practice Ayurveda in Australia anymore because of this one formulation. You may or may not be aware of this news. I can send you more information. Now, this Manasamitra Varakam was made somewhere in Kerala, and it was shown to contain many fold excess of arsenic now, and some other things. Now, what do we do to prevent these kind of problems? So on one hand, we have all 3 presenters have done justice to the topic of how we can take knowledge from the Samhitas and then show it is working and validate it. And the question that you have addressed a little bit is in how quickly we can take it to other institutions across India so that we get a benchmark, of how we got to do these studies. So if it's anxiety, then we can say, this is the minimum that we have to do for future MD thesis, whichever department in whichever college or university in the country is doing a work on anxiety anxiety, depression, should use this baseline and cannot do anything below this, but must improve on it. So Agnihotriji will comment on this because it was in one of our previous webinars 2 or 3 days ago about incremental improvement in those standards for our MD, PhD thesis work. And your PhD model thesis in 2006 from Nimhans is very, very important because it is a way to take this a big national institution, the National Institution for Mental Health, etc., and to take an Ayurvedic formulation, and you fought your position there and you defended your position on using this very important formulation. Now, you are heading a department. What can we do to do two things? One is to across the country with senior professors like Agnihotriji, push for minimum standards. That means this is the benchmark. We cannot do below. In 2023, nobody can do a thesis below this standard. Can we set some standards? Number two, in a global scenario, how to convey that this is what we have. We have something called Brahmivati, and this is Brahmivati. This is the minimum standards for Brahmivati. And these are the studies that have completed to date with Brahmivati. MD thesis across the country, PhD thesis across the country. No future thesis can do work below this standard. It must approach the next stage. Is this something we can do? And I would like to get some comments also from Agnihotriji after you have addressed. I hope you got my two points. One is minimum standards of our future studies, so that our students know, okay, we can't do anything below this. First, you go and read what has been completed, find out what has been published, PhD level, MD level, and then work to advance it, and incremental improvement. Every year, a little better, a little better, a little better.
So, like whatever the synopsis we have generated now, so again, I think a few of the many other colleges and other researchers are taking a template and trying to use the same synopsis with different drug, etc. So I think that itself is a, like I feel it's a very, like again, translational approach where people are using that model. Maybe because I have some work with Nimhans and psychiatrists and maybe like some research institutes, I have a little bit of insights. And I think the same, so whatever we generated have been being used by different people, of course with different drugs, because in thesis we can't duplicate the study. That's one thing. Second thing is we can make a network pharmacology or we can make a network components. Again, we are doing a thesis. We are looking to the consideration of budget. So we can't like again they are like again finance etc. will not provide to students. By looking to constraint what best you can design the protocol we are doing. I think it is doable in the other institutes also. And the same design can be applied in the different centers. We can generate raw sample size and multicentric component, and we can take up the studies. Number one. And Brahmivati, Manasmritaka ingredients and the maybe like drug, etc. Maybe I'm not authority to speak about that. Maybe Rasastra, Baisajya people can throw a better light on that standardization.
Thank you. Basavaraji, thank you. At least you have recognized some things. The issue about funding, I agree with you a little bit, but I think the future is for opening up more funding, and we need some innovative ways. And in a webinar 2 or 3 days ago, we were discussing this point, All India Institute of Ayurveda in Delhi. We said we must make a central database of all the MD, PhD theses that are completed in the country. We have 700 plus Ayurveda colleges, many of them. I think Agnihotriji will tell us a little more about those numbers and what we thought about. And maybe that is a need. And we need that baseline from where we can progress. Please.
Yeah, regarding the thesis, etc., I think UGC or government sponsored, there is some repository is there.
Show the Ganga is there, yeah.
Show the Ganga. So where the repository is maintaining all the thesis, MD, PhD level across all the streams.
Now, before I give the floor to Agnihotriji, one question on this. Why can't we interact with researchers outside India? If we take Brahmivati, I'm sticking on Brahmivati because in one of our very early webinars, we were discussing Brahmivati and we were talking about hypertension before the meeting started. And Agnihotriji was very right in saying Brahmivati will improve the quality of sleep. Brahmi will improve quality of sleep. And in turn...
I think you are referring to our study, sir. We had one more study in which...
That's right. Yes, from Belgavi.
Again, it's our study only. I think you are looking at those results where we had looked into that. So it reduces the systolic and diastolic blood pressure.
Exactly, with hypertension. Yes.
Hypertension, and also improves sleep and improves the decreases depression and quality of life and subject to something like we are looking to
exactly. And I think we had one of the speakers from who was on that paper with us. So the question now is, we have something that works. Why don't we take this forward to the world? What is stopping Belgavi from saying we are a global center looking at Brahmivati and Brahmi for hypertension? Is there something stopping you from doing this? Because hypertension is a global problem. So we are saying Belgavi is the world as a global center for research based on 1 or 2 publications that we have on Brahmivati. We call ourselves a global center for Brahmivati for hypertension. So one small team, it's a global center. So we are going to be the reference point for all the work on Brahmivati. On this day, this kind of thinking is very important because we are talking about the big problem. Hypertension on one hand is not described in Samhitas, but when we use Brahmivati, it seems to reduce many other, it improves quality of health, etc. So I want to just hold you on that one point. So keep that thought in mind. I want to draw Agnihotriji here to just give his impression on today's talks and 1 or 2 of the points, but I want to give you a little time to think about why you feel Belgavi shouldn't become a global center for hypertension and Brahmivati research. Okay, Brahmi research in hypertension. Okay, so one point, just hold this, and we just bring Agnihotriji is retired as professor of Swasthavrit in Uttarakhand Ayurveda University and studied in BHU. So, and one of our respected senior members here on this platform. So we will hear something from Agnihotriji and then come back to this question. So I'd like you to justify as to why you cannot be a global center, why you cannot be a multi-million dollar global center on hypertension in this scenario, what we are discussing today. Agnihotriji, Pranamji.
Sir, thank you so much. Thank you. Namaskar.
Namaskar ji.
It's our pleasure that we are having such a great persons, academicians, researchers on today's webinar, especially Dr. our Basavaraj ji, who completed his PhD work from a very reputed institute. So all his work is really appreciable. I would like to stand with some points. Of course, we will take up Brahmivati also. We had been having so many discussions with Brahmivati, as we had a very good talk that how Brahmivati will be useful. So in case of the insomnia or sleeplessness, so I told that most of the time that when there is hypertension, so the excess flow of the blood in the brain. So if it will go down, the sleep will come. The hypertension and insomnia both will be meet out simultaneously. This is what my thing. But on other hand, I'll see that we are celebrating today the World Health Day, and we are much more talking about the medicines. Let us have some talk over the health also. And when we start with, we know that the topic was given by our first speaker, Harshji, that Ayurvedic holistic health. So what I think that it is not the Ayurvedic holistic health. Ayurveda itself having the holistic approach, irrespective of the healthy or unhealthy person. As we say that Sarve Bhavan Sukna, do we think that they are talking only for the ill persons or the diseased persons? Sarve Bhavan Sukna. Whosoever is alive should be at ease, with blissful, with the enjoyable pleasure. It was high thinking. And by whom it was thinking? It was thought by the sages, the great person, the Mahatmas, the Sadhu. And for them, there was no family, and they were engaged as Sarvabhut Hite Rataha. Since they were always after the pleasantness, after the comfort of each and every creature. That's why the resolution was Vasudhaiva Kutumbakam. When he himself, when they themselves were not having any family, so the whole universe was the family, and they were talking about, they were thinking about their health. So we know that we cannot face, or we cannot have the sectorial health or factional health. We have to have, if our heart is good, but liver is not good, will we say that that person is okay? He is not enjoying health. So neither sectorial health nor the factional health be considered as a health. This is, here comes the Ayurveda. Ayurveda talks about the holistic approach. I, coming from the preventive medicine side, who will talk for the healthy persons. So our approach is for today's World Health Day, that most of the time we must talk about Dincharya, Ritucharya, Sandhyacharya, Ratcharya, Sadavrat Palan, Treupastam, Veg Vidharan. This is what our package is, and this is especially applied over the healthy persons. And when there is any disease situation is there, we will pick and choose according to the tolerance, according to the Pathyapat for the diseased person. So in this way, as far as the Brahmi is concerned, let us see why, what is the hetu, what is the etiology behind the lack of sleep in that individual's case. It may be mental tension, it may be family tension, it may be financial factor, it may be family factor, it may be non-proper placement of their kids, and there may be some lacking of the education. So many factors which are emotionally affect the mental status of individual, irrespective of his physical health. So Brahmivati will do its work, but let us also talk about that thing which is affecting his mental status. This is what I would like to put forward at this moment.
Thank you. Agnihotriji, thank you. You have drawn the essential fundamentals, the wider determinants of health, and we have to bring that also. Maybe Basavaraj can bring all that also into his center, the global center that he wants to do, global center for something on holistic health for hypertension or something, the case that I gave was just based on some work that is coming from Belgavi and to build on the strength. So Agnihotriji, your point is extremely important to look at the wider determinants of health. And we are saying we cannot separate this thing out and just give a tablet and say it was going to work. No, that doesn't work. I think, acknowledge your point. Please, Agnihotriji, I want to see if Domaji wants to make a comment early on. Domaji, namaskar. Domaji, namaskar. If Domaji is not available, Basavaraj, would you like to respond on this? I think senior person, we needed a senior person to give us some change in our thinking here. Agnihotriji is right in saying that from the Swastavrit aspects, there are many rich recommendations that have to be satisfied. So when you go into this analysis, we can't just say we'll give you a tablet and it works, which is like the modern medicine approach. That is not the correct way. We need to remind people that there are many other factors. It came through very nicely, Basavaraj, in your presentation today. Would you like to just add to something that Agnihotriji mentioned? But the perspective is, the point I want to convey is that we must be a little aggressive in taking global positions where possible, in terms of health. For me, the place where Agnihotriji is located is very special. Uttarakhand is very special. I put this very bluntly and openly, saying we want as many centers of global eminence in Uttarakhand. So this is a wish on my side that we develop these kind of thinking going into Uttarakhand and going into Himachal Pradesh, very beautiful places. Paprola is a very beautiful place. There is a center that is already coming up in Paprola for geriatric health, And again, there will be some valuable things at a global level. So the happening in Jamnagar is one example, but that doesn't mean we cannot think of other global centers. Agnihotriji, so this is what was in my mind when I raised this one point. So
your dreams are really most appreciable, and really you love nature and the sights of nature, which are
absolutely
clad with sometimes the snow and also clad with the Ayurveda. Both the ambitions will be fulfilled whenever you visit over here.
Agnihotriji, you are in the land of Devbhumi. I always tell my friends and colleagues here in Austria that the highest mountain in your country is whatever, 4,000 meters or something. And I'm saying in Uttarakhand,
7,000 up to 10,000. 10,000 11,500 Kedarnath ji. Kedarnath is at 11,500 feet.
And I'm saying in that one state of Uttarakhand, we have more than 100 peaks in excess of 6,000 meters. Right. So come to Uttarakhand and come and enjoy what we have. So Basavaraj, and in your land in Karnataka, you have Sringeri, one of the 4 mutts set up by Adi Shankara and his Vasudeva Kudumbakam thinking, Advaita Vedanta thinking. These are all strengths that we have. You have JSS group of institutions, you have SDM group of institutions. Where do we go from here? We want to see if we can distill this into some recommendations for the future. Thank you, Basavaraj. Floor is yours.
Yeah, sir. Regarding the international, I would like to quote what happened before COVID around 2 to 3 years back. So our KL University has a collaboration with Thomas Jefferson University, Philadelphia, TJU. And they are running almost 15 years NIH funded project on maternal health. And they were interested in integrative medicine. So for that, again, 2 teams had visited my OPD, Manas psychiatric OPD, and they spent around 2 to 3 hours, how we are doing integration. And that was the, again, first visit, and later they came on second visit. And we were looking forward, again, we also in funding, etc. Again, then that was a post-COVID. So we had interactions, and they sat in the OPD looking to, again, at that time. So they mentioned that at least English-speaking patients you can collect, and we had interaction with the patient there on interaction. So that was the 2 occasions where we had an interaction with the Department of Integrative Medicine from TJU.
How big was the team from Thomas Jefferson? How many people?
3-member team. Yeah, 3-member team.
Okay.
3-member team.
How long did they stay in Belgavi?
So I think that they had visiting there again. They are looking into the other again maternal health and other aspects. But I don't know exactly for how many they were staying. But they visited my OPD for 2 to 3 hours twice in a matter of that I remember. They told me we want to visit. So mental health they were interested, integrative mental health. Then I told we are doing integration with counseling and drugs and de-addiction, etc. etc. We're doing in a very primary way. We don't have data, but we have some patients, and they are not that homogeneous, heterogeneous. We mentioned that, but they are interested. They came over and they were appreciating our very little work.
This is a very good initiative. Thank you for sharing this information with all of us here, because Thomas Jefferson is a very important institution in the States. Sometimes I feel, Basavaraj, when we raise these, like what I'm saying, raising some ideas, then we have to find partner institutions and anticipate a long period of interaction, because they are coming to a land with a new culture. They're trying to understand a discipline which is completely different. They don't know what we mean by all the terms. Avdesh Pandeyji, if he was here, we could have heard from Chandigarh, person who's in charge of integrative health in Chandigarh, about the difficulties even people in India of Indian origin have in understanding the deep and rich concepts in Ayurveda. And that's a bridge we need to make, and we need to be active in that space. So we have to think about a way to make it happen in India also, not just connecting. But so happy that you mentioned about, are there any other examples you have? I wanted to see if I can also draw in Sriharsha ji, and just to touch on this point about interactions and how we can make it more accessible for everybody, for modern medicine people. Karnataka has so many extremely good modern medicine colleges. You have St. John's in Bangalore. You have so many other very well-established, well-respected institutions. What is that dialogue that is happening, and what needs to be done?
So currently, at our level, we are collaborating with the 2 medical institutes. One is like Kelly Medical College, that is MCI recognized. Another is we have University of Malaysian Science, USM, that is University of Science Malaysia. So there's an international medical program which is being conducted in under Kelly only. It is only dedicated for Malaysian students. Say government Malaysian students, government scholarship students will be coming over here and they will be conducting. So with the Department of Medicine and Department of Psychiatry, with both institutes, we are running few of the smaller studies currently.
Are you happy with the progress? Could you handle, say, 5 more countries coming, visiting KLE, Belgavi?
Of course, we'll be more happy, sir.
You have places where they can come and stay. If they come to Belgavi, they have hostels or something, or where you can accommodation or something if they want to come. Okay, I'll give you one example. This is also for all of us here. If here in the Europe, when the students are studying medicine in the final year, they get an option to go and spend 6 months in some place, wherever in the world. It's a global exposure, and they come back with learning what is happening. And can we offer KLE and Uttarakhand, of course, as a place, or Paprola, or some of these beautiful places? Can we give them a challenging project, so that these are final year students, they have learned the theory, they have had some clinical experience, and now we can challenge them saying, okay, come and learn about integrative approaches, and come and take this to the next step. Your PhD thesis, you did a lot of work on the interaction with the autonomic nervous system, etc., etc. So you understand. Can we push these students by saying we offer 6 projects here, a continuation in global health? Okay, come and learn global integrative health, something like this. Is this possible?
So I think technically possible, and I think you have your good friend Dr. Sriharsha Shetty, who is the principal and administrator. He can take up this question.
Thank you, because
he can talk to Kiel University, and I think it's possible.
I'm trying to see if we can distill some outcomes out of today's wonderful presentations.
Sir, I think from Uttarakhand side, if such students come on their own expenses, along with their study visa, and if they get the due permission from the Vice Chancellor or Registrar of any of our university, they can be given the integrated system, approach of whatever we are doing in our Ayurvedic colleges, in our hospitals. So they can be given the practical say demonstration in Panchkarma also, and they will be given the attendance along with the certificate that they attended so many hours say duties in hospital and clinical site. This much can be done, provided they should come with the study visa and get the seek the permission from the higher authorities of university before leaving their country.
We will thank you, Agnihotri. I think what we will do, now that I've heard willingness, then what we will do now is to set the channel correctly, so that it goes through all the channels, and there are no problems with funding, and no problems with visa, and no problems with all those issues. They will have many questions they will ask. The universities will ask these questions, and we can answer those things. But I think it's lovely if we take the initiative by saying we offer positions for students from wherever in Europe to come to these select universities, north, south, east, west, and spend 6 months to learn about integrative approaches to understand what is Vastavrit, understand what is Sadvrit, understand what is the Ayurvedic approaches to GI tract problems or aging or whatever it is. We can make a big portfolio. And I think
because sir, during my study period in BHU, there used to come the persons coming from other walk of life. They may be medicos or may not be. Like from Italy, Gurdet Kim was there. One Ricardo Estrada from Latin America, Central America. He was very much there. He was ND, Doctor of Naturopathy. So they were always coming and studying, having a 15 days or so permission. They were very much interested for the Ayurvedic physiology, Shri Kriya Vigyan. So they used to come when the qualified students in a form of say graduation, running graduation course as a part of internship. If they come with all due say homework, I do hope that India government will allow and send them to any of the center of their choice or wherever the willingness will be there from the university side. So it will be a great bridge work. Okay.
Bridge work. Thank you, Agni.
I think the right person is Dr. Sriharsha Shetty, because he was heading the international some medical programs for the overseas students in Assam. Currently, is doing that. I think he has a lot of experience and already into that component. I think the right person is Dr. Sriharsha Shetty.
Thank you, Basavaraj. This is important because I still feel there is a lot of hand-holding and bridge making to be done. Because our knowledge is very deep. If somebody who has never heard about Ayurveda has to understand darshanas, it is a big challenge. It's not easy because our thinking is based on the depth of that knowledge. If they have to understand how we in Vaisheshika, we say the Dravyas are only 9, and there are only, Dik is also a Dravya, then it becomes, they get confused, they have no idea what we are trying to say, what is it that we are trying to convey. And we take for granted that they will understand, but it's a big jump to make. So this is a good outcome from today's discussion. I think it's giving us something tangible that we can present as one of the outcomes of today's discussion. I want to see if Sriharsha ji would like to. Sriharsha ji, would you like to add something? Also, Hema ji,
Yes,
are you still here with us? Hema.
Yes, sir. Yes, sir.
Hema, thank you for.
Yes, sir.
Hema, can you hear us?
Yes, sir.
Okay, Hema, I have a question for you. You have presented today wonderfully. You have distilled the connections between chakras and mudras and bija mantras.
Yes, sir.
And you have used one word, activation of chakras.
Yes, sir.
Could you tell us a little more using, first of all, terminology from the Samhitas, the term that is used either in Ayurvedic Samhitas or the Yoga Samhitas? What is this activation? What is the correct Sanskritam word for activation? What is it that you are pointing to?
Yes, sir. Actually, here I like to mention about my guru, about this explanation of these chakras. He is Dr. John B. Nayagam. He is actually a diabetologist in Alopath. So I was very much amazed to get the knowledge from him. And now I have started using this with my health seekers.
Hema, my question, thank you for pointing us to Dr. John Nayagam.
I'm coming to the point, sir. Here actually it has 3 stages. What I have learned from is 3 stages: stimulation, activation, and awakening. So starting will be the stimulation. These bija mantras, when we start chanting, these chakras will get stimulated. Then with the consistent practice, it will get activated. Activated in the sense it will start working. First, the stimulation process occurs, then the activation, and finally comes the awakening. So in our daily samskaras, during the daily chores, we will go only with the stimulation activities. With the consistent and persistent practice of all these chantings and respective mudras on a daily basis, definitely it will get activated and awakened in the later stages. Maybe the sadhus who were completely involved in this, their chakras would have got awakened very early. As we are with the daily going with the daily chores, I feel our chakras will get stimulated initially, and then gradually it will go to the process of activation and finally the awakening part.
Now, a
This
lot
is
of people,
what I
thank you.
have understood.
Hema, thank you for elaborating. And a lot of people will say, I don't believe this. What will you
This
do?
is what I would like to justify this point, because I personally have got many health seekers post COVID. This is my personal experience, and even I have given these testimonials from them in the social media, and I'm getting more and more responses daily. And I am handling online cases and offline also. Online is mostly international cases, Qatar, Korea,
Yeah.
and UK, US, Canada.
Yeah.
And
Now, I want to
Malaysia.
stop you. Hema, I want to stop you there now.
Yes,
Now,
sure.
in...
सर हम लोगों की नवरात्रि चल रही है, अग्निहोत्री जी को भी रात को पूजा करनी पड़ती है खाना खा के।
अच्छा जी, शाबाश।
मैं वही प्रार्थना कर रहा हूँ, वो केवल रविवार तक की प्रॉब्लम है, नवमी है रविवार को।
चलो जी,
हम लोग 6 दिन के भूखे हैं। We have not taken food from last 6 days.
Please stop us.
I even no fruit, only liquids.
Pavanji, please stop us when we have gone past our time, because these are discussions, important discussions. Some points come out.
I know, sir. It is my
Please
humble request, because Navratri is there, no, sir. We are in puja.
Please stop us when you say.
No, how can I stop you, sir? No.
Because it's
no,
9 o'clock.
Not at all, sir.
No,
not
it's 9
at
o'clock.
all, sir. For अग्निहोत्री जी आवाज भरी, क्योंकि मैं तो आपको co-host बना चुका हूँ। मैं तो सो जाऊंगा अभी पट करके।
Okay, now Hema, I have put Dr. John B. Nayagam's coordinates here. We will come back to this. Please put your Hema, please put your contact details. I think I have your contact details, so that's fine. Sriharsha ji, if you have any comments you would like to add, we have reached the 9 o'clock deadline, as Pavanji correctly says. We are going to draw this event to a close. If you would like to add a few words about today's event or anything else you want to add, Sriharsha ji. Sriharsha ji? No. Pavanji, I know it's 9 o'clock. We said we will try and draw this event by close to 9 o'clock. We have at least one or two very firm conclusions from today's event, which I'm very happy about, that we will continue discussions with Agnihotriji. I leave it. Pavanji, thank you so much for bringing so many three wonderful speakers today. And the points that we've touched are very important, particularly Sriharshaji's comments on looking at some fine details in the text. He has published other things also. Hema's comments on how to link the chakras, and she is convinced that these things work, but we need to get a little more evidence. At least she's given us the name of John B. Nayagam at the Diabetes Center. And finally, Basavaraj, thank you. Delight to hear your presentation.
Yesterday after you, sir, on chakra, detailed discussion was there.
Oh, I'm sorry, I missed this yesterday.
AYUSH and chakra.
Thank you so much.
So that details can be observed there also.
In the recording, I will view this. My apologies yesterday, because we had a visitor from the Czech Republic who is also doing mantra chikitsa, chakra chikitsa. So there is interest here in Europe. This is why I'm pressing that one point. So Pavanji, I will follow the recordings, and thanks to all our speakers today. Basavaraj, we are so fortunate to have you with us here today. Thanks to Suhash for bringing you to the platform. But
really, thanks to Suhash. Thanks to Suhash. Excellent, sir. He is supporting like anything. He is our resource person, no doubt.
Exactly. Suhashji is pointing so many people to us. Before I go off the line, I want to thank Domaji. He has no comments today. JSG, thank you so much. And leave it with you, Pavanji. The platform is yours. We are past
the day after tomorrow, astrology for good health.
Amazing. Look at this.
5 astrologers will be there to guide us on astrology for good health.
Basavaraj, I have only...
on Sunday, World Homeopathy Day is there.
Oh, beautiful, Pawanji.
So 2 homeopathic doctors from London and 8 doctors from India will celebrate with us World Homeopathy Day.
Super.
And on 11th, National Safe Motherhood Day is there. So we will be celebrating that with all gynecologists of Ayurveda. Lakshmi ji is there, Gayatri is there, Pratiksha ji is there. We will celebrate for Sutika Parcharya.
Shabash.
So it will be also a unique topic, Sutika Parcharya. So I would like to request you all, so please join every day whenever you have time. And now joining is, sir, means matter of few seconds, we can join with mobile and keep it aside. So we can be enriched with the brainstorming sessions. And now, without wasting much time, I would like to request Jagdishwar ji before Agnihotri ji for 2 minutes his blessings on the topic. Brief, sir. Welcome, sir. Sir, नाराज हैं हम.
Doma ji, namaskar. Doma ji है हमारे साथ, पवन जी?
है लेकिन नाराज हैं सर.
Doma ji, namaskar.
दादाजी नमस्कार, दादाजी नमस्कार.
प्रणाम सर, प्रणाम.
मदन जी नमस्कार.
आपका 2 मिनट बिना आशीर्वाद लिए कैसे खत्म हो सकती है सर? बस क्योंकि
ऐसा कुछ नहीं है, लेकिन काफी अच्छा ही हुआ. आज जितने भी डिटेल्स मिले हैं और साथ साथ जो है ना, अभी काफी समय लगेगा. मदन जी बोल रहे थे कि चेक रिपब्लिक और यूरोपियन कंट्रीज आर वेरी मच इंटरेस्टेड इन दिस. तब वो लोग एक्चुअली थ्रू योगा एंड थ्रू सम अदर practices of भारत, तो वो लोग इंटरेस्ट इसीलिए कि they are fed up with materialism. Now they want to come to spiritualism. The spiritual aspect should be explained to them in a systematic and scientific way. It takes a little time because it is going much for the leadership of Bharat. Thank you very much.
Thank you, Doma ji.
And much more was excellent presentation.
thank you, sir. Thank you very much for guiding us. I would like to request now V.K. Agnihotri ji. He is also on Navratri Puja.
Thank you, Pawan Sharma ji. Thank you, Professor Madan sir ji. We will sum up with few sentences. Our celebrations was to commemorate the World Health Day today in our 351 webinar, and Professor Madan sir introduced us after the inaugural words from Professor V.R. Sharma sir, that one earth, one health, and which is the notion given by our respected Prime Minister Modi ji, and he just made it to the available concept of our Shankaracharya ji Advaitvad. So this was the basics which was put forward in our platform today, and we extend our respect to Professor Madan sir ji, Professor V.P. Sharma sir, Professor Dr. Jagdishwar Doma ji, Dr. Annapurna Rani ji, Vaidya Jayesh Thakkar ji, Dr. Avdesh Pandey ji, our Sriharsha ji, our Dinesh Kumar Das sahab, and all our 3 great speakers. Dr. Sriharsha ji started his talk with the Purnam Purnamidam. So he talked about that, and he emphasized about the concept of the holistic health and how Ayurveda deals with. So his full detailed and full of volume presentation was there. Repeatedly he pointed to all these things. But I feel that how long we will be plunged into the linguistic network of our text, which are always there. Repeatedly we say this, and Lok Samya and all that. When we start dealing it with the it's means a clinical approach or it's a practical approach, then the real applicability of our text will be achieved. So this is one thing I would like to add in this thing. And our second speaker was Dr. Hema Malini ji. Very naturally, she pointed out on 3 points. The one is this Panchakosh Siddhant. The other one is Mudra, and the last one is the chakras. And she correlated all these things. So really, we had a good discussion 2 days back. So I think the chanting and the direct demonstration led to her perfection, and I do hope that with her perfection, I don't think that any of the patient will be not getting relief from her treatment. So it's very good. And next comes our Basavaraj ji. As per his knowledge and approach, he underlined all these subject matter repeatedly, that how the holistic health concept be achieved by observing all these principles of Ayurveda, which is always there, and not only in India, worldwide it has been accepted and so as long we will approach and we will open the newer vistas for Ayurvedic sciences, for yoga sciences, it is getting accepted and it will get more and more acceptance throughout the world. This is what we can submit on today's webinar. Greetings to all our speakers and our respected persons for World Health Day today. Thank you. Thank you so much.
I would like to humbly request, sir, for cooperation for 12th April, that is beyond Earth, human space flight. What astronauts are instructed to take medicines for there in a spacecraft. If anything is herbal there or Ayurveda, so this will be our first journey to space with astronaut. Madan
Sir,
sir,
why only herbal? Water and air is also ours. It comes under the Panchmahabhutas, and we are advocating for the Ayurveda. So at least without water and air, nobody can survive. So even for astronauts, they were enjoying in any form of the water and air. Thank you, sir.
And for Hanuman Jayanti, we are inviting speakers from Ayodhya, UP, Uttarakhand, from where Hanumanji took that Sanjeevani, and from Sri Lanka, where he went. So for Sanjeevani myth or fact, that will be the topic. Then World Heritage Day. Sir, Ayurveda Rich Heritage, please guide me. Some speakers, few expert speakers for heritage, who can explain a heritage of Ayurveda. And for this 21st April, Civil Services Day. Again, I am requesting, because we have one Chief Minister in Goa, we had Chief Minister in Chhattisgarh, who was Ayurvedic graduates, and numerous Ayurvedic graduates are involved in civil services. If anybody knows any Ayurvedic doctor who is in civil services, please guide me, please recommend me. And on Sir Madan Thangvelu, sir is repeating one excellent dialogue daily. 22/4/22 Earth Day is there. So what should be the topic for Earth Day? One health, one earth, sir was telling. So please recommend me for a speaker, sir.
Save electricity. On Earth Day, the motion is save electricity.
Yes.
This is very important. Yes.
So please guide me, sir. Please guide me. Here I am really facing problem to identify suitable speakers. And from Madan Thangvelu, sir, I have folded hand request. Please guide me. Our next webinar should not be conducted without any international dignity.
Thank
It
you.
is my humble request.
Thank you.
One dignitary only I beg from you, sir.
Correct.
International dignitary, maybe Indian, maybe non-Indian, but interested for Ayurveda or Ayush, we will welcome. But our aim, we are trying to reach up to space. So internationally, please guide us. Please
Thank you.
guide.
Will do, Ji, will do.
And your excellent moderation, sir, inspire us.
Hari Om.
Inspire us. I am
Hari Om.
trying to learn from you. You and
हरिओम।
Agnihotri ji.
सर
Really?
हमारी गलती भी बता दिया करिए प्लीज।
नहीं आप नहीं मेरे को तो दोनों का एक बड़ा अच्छा लगा, जिसको अपने ग्वालियर की भाषा में कहे कि सर बड़े सुंदर ढंग से लपेटते हैं, फेंकते हैं, और अग्निहोत्री जी बड़े सुंदर ढंग से लपेट लेते हैं। एक्सीलेंट, अरे ग्रेट नॉलेज सर। थैंक यू टू स्पीकर्स, थैंक यू वेरी मच।
हरिओम। हरिओम।
Thank you.
अग्निहोत्री जी प्रणाम जी, नमस्कार नमस्कार नमस्कार। बासवराज जी नमस्कार, दोमा जी नमस्कार, हेमा जी नमस्कार।
Thank you.